We are on the safe side. The custodians of the national anthem are very much around. The director Noah. So that's the new guidelines. Events of this nature will be taking the first stanza, except national events, Armed Forces Remembrance Day, Democracy Day, and the likes. That's why we will be taking a complete, basis of the national anthem. A'udhu billahi samina alim minash shaitanir rajim. Bismillahir rahmanir rahim. Your Excellency, the Executive Governor of Katsina State, Dikko Radda PhD, CON, represented by the Secretary to the Government of the State, Barrister Abdullahi Garba Faskari, the convener of this very important gathering, Her Excellency, the First Lady of Katsina State, Hajiya Zulaihat Dikko Radda, wife of the Right Honorable Speaker, wife of the Chief of Staff to His Excellency, members of the State Executive Council that are here, especially the Honorable Commissioner, State Minister of Health represented, the Honorable Commissioner for Basic and Secondary Education, as well as Honorable Commissioner, Minister of Women Affairs, the representative of His Royal Highness, the Emir of Katsina, who is also the Endakan Katsina. He is also the chairman of the State Social Mobilization Committee, the Executive Secretary of the State Primary Healthcare Agency, Dr. Shamsuddin Hajiya, as well as the coordinator of the MRV Northwest Zone, Dr. Kabir Mustafa, however, local government chairmen that are here. I can notice that of Katsina, Kafur, as well as Kusada, wives of the executive chairmen of the 34 local governments, as well as wives of the honorable members of the State House of Assembly that accompany the wife of the Speaker, Her Excellency Steering Committee members, directors, Director Noah, as well as directors from the State Minister of Health, directors from the State Primary Healthcare Agency, our various partners that are here, notable among them the coordinator of the National Primary Healthcare Development Agency. We have here also in our mix WHO, UNICEF, CDC, AFNET, New Incentives, All Babies Are Equal, Markings, Co-Group, as well as the GSI, Sultan Foundation, Chigari Foundation, other interest group, especially the Medical Women Association of Nigeria and the likes, leaders, students, other highly respected guests. Ladies and gentlemen, Assalamu alaikum. We're pleased this morning as we gather here in such a large number to join the League of Other States for the launching of the Sensitization, one-day Sensitization program on the importance of the Measles Rubella MR vaccine. Your Excellency, the Governor, other distinguished invited guests, a few remarks will make the day, but the climax of this gathering will be a final discussion by experts showcasing the relevance of this MR vaccine, and time will permit. Definitely we will give chance for the audience to ask questions and make comments. But then first on the item on the agenda, I'd like to invite Sheikh Samu Adamubakuri to please give us the opening prayer.
صلوا على النبي الكريم. اللهم صل على محمد وعلى آل محمد كما صليت على إبراهيم وعلى آل إبراهيم إنك حميد مجيد. اللهم بارك على محمد وعلى آل محمد كما باركت على إبراهيم وعلى آل إبراهيم إنك حميد مجيد. اللهم اجعل جمعنا مرحومة وتفرقنا معصومة ولا تجعل بيننا ولا حولنا شقيا ولا محرومة. اللهم اقسم لنا من خشيتك ما تحول به بيننا وبين معصيتك، ومن طاعتك ما تبلغنا به جنتك، ومن اليقين ما تهون به علينا مصائب الدنيا، ومتعنا اللهم بأسماعنا وأبصارنا وقواتنا ما أحييتنا، واجعله الوارث منا، واجعل ثأرنا على من ظلمنا، وانصرنا على من عادانا، ولا تجعل مصيبتنا في ديننا، ولا تجعل الدنيا أكبر همنا ولا مبلغ علمنا ولا منتهى آمالنا ولا إلى النار مصيرنا، واجعل الجنة هي دارنا ومصيرنا، ولا تسلط علينا بذنوبنا من لا يخافك ولا يخشاك ولا يرحمنا. اللهم آمنا في أوطاننا وأصلح أئمتنا وولاة أمورنا. اللهم ول أمورنا خيارنا ولا تول أمورنا شرارنا. اللهم ارفع مقتك وغضبك عنا. ربنا آتنا من لدنك رحمة وهيئ لنا من أمرنا رشدا. ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار. وآخر دعوانا أن الحمد لله رب العالمين.
Thank you very much. That has been the opening prayer. Your Excellency, the Primary Healthcare Agency is the agency saddled with the responsibility for all vaccine-related issues. And we are pleased to have here in our midst the Executive Secretary of the Primary Healthcare Agency. So it is my honor to invite him to the microphone for a kind of welcome and opening remarks. Executive Secretary, sir.
Your Excellency, the Executive Governor of Katsina State, who is ably represented by the Secretary of the State Government, Your Excellency, the First Lady of Katsina State, Hajiya Zulaihat Dikko Radda, the MC has established a very long protocol. I would like to stand on it. I would like to welcome each and every one of us to this very important significant day, which is to mark the sensitization of a very important antigen, Measles Rubella vaccine, which is going to be introduced into the country, Nigeria. For many of us, I'm sure we are aware of measles. Everybody knows what is measles. We know it. I'm sure we know somebody who has been affected by measles. But a lot of us are not aware of rubella. In fact, only those in the, within the clinical cycle are aware of rubella. We know Kenda, which is measles, but for rubella, even myself, I tried to Google the local name. You know, since yesterday, some call it Korajen Shekara, some call it Masasara Koraji, and so many other names. Somebody was telling me it's called Busagogo. So, but it is here. Evidence has shown that we have a lot of children coming down with rubella. And as we continue with the program, where we are going to discuss with our panelists, we are going to see, they are going to talk more about rubella and its impact. For measles, measles is, I will say, the leading cause of childhood mortality in Nigeria and across the globe. And Nigeria has the second largest burden of measles in Africa, only second to the Democratic Republic of Congo. There are 295 LGAs that are currently having one case or other form of measles outbreak. And Katsina State has the highest number. We have 24 LGAs, and we have been responding to measles. So this is an opportunity for us to strengthen and ensure that all eligible children are protected against measles. In the year 2019, previously we used to have one dose of measles which is given to children. But 2019, the second dose was introduced. You give it at 9 months, then later at 15 months. With the emergence of rubella, we are going to have a combination of measles and rubella, which evidence has shown that it's going to give more protection compared to having measles singly. For rubella, because the clinical manifestation is not as severe as measles, it goes unaware. But one thing is that a mother can transmit it to her child, unlike measles. So we have congenital rubella syndrome, which will manifest with some clinical symptoms. I'm sure the experts are going to discuss about that. So this gathering is for us to sensitize the general public about the importance of this introduction, which the expert, Dr. Kabir Mustafa, is going to talk about that. And we've had a lot of several engagement, of course, through the leadership of Excellency, the First Lady, culminating into today what we are going to do. So we hope that this will kickstart a series of events that will lead to ultimate immunization campaign, which we hope to do it in October, which we are going to combine it with polio campaign. So we want to thank everybody for coming and to welcome you as well, including the chairman of the executive chairman of the 34 LGAs and the representative of the LGAs that are here, our religious and traditional leaders. We work hand in hand, and of course our development partners and the caregivers as a whole. So inshallah, we are going to work together to ensure that we reduce drastically to the minimum the catastrophic effect of measles and rubella in Katsina State. A takaicen takaitawa ina ma kowa da kowa barka da zuwa wannan taro na gangami domin kaddamar da allurar rigakafi na measles, watakan bakon dauro, da shi rubella, wanda nake ce muku sunan shi da Hausa, waɗansu su ce mai ƙuraje ɗan shekara ko masassarar ƙuraje. Rubella is also ana kiran shi German measles. So su wannan allurar rigakafi insha Allah muna sa rai za a kaddamar da shi gaba ɗaya a Najeriya. Jihar Katsina tana ɗaya daga cikin jihohin da za a yi wannan allurar rigakafi daga watan Oktoba. Za a yi shi as a campaign yadda ake na kwana 10. Bayan nan za mu sa shi cikin tsarin allurar rigakafi na yau da kullum wanda ake yi, za a riƙa yi wata 9 sai wata 15. Amma wannan gangamin yara daga wata 9 ne zuwa shekara 14 su za a yi ma wannan gangamin, domin abin da ya samu ka extending, especially yara mata idan suka same shi za a haifi yara wanda zai jaza musu matsala, wanda akwai ƙwararrun likitoci, za mu yi panel discussion, za su ƙara mana bayani game da shi. Yana ɗaya daga cikin abin da ke kawo makanta a yara. Shi kuma mun san cewa ƙyanda mun san tana ɗaya daga cikin cututtukan da suke jaza mutuwa na yara. Abin mamaki jiya na gani a CNN, America ta sami wannan ƙyanda na measles wanda cikin shekara 33 ba a sami irin shi ba. Za mu yi tunanin cewa America tana is well advanced, ba a samun wannan. but tun daga zuwan covid sai aka samu waɗanda suka yi coalition wanda su ba su son arƙin allurar rigakafi. To yanzu haka ana ta samun mace-mace a america ma, saboda haka shi yasa muka ga wannan campaign da za a yi wanda Her Excellency ita take jagoranci yana da mahimmanci kwarai da gaske, kuma shi zai kara idan muka samu duk yaron da ya kamata a yi wannan allura aka yi ma, insha Allahu mace-mace za su ragu. Kuma shi kyandan nan banda ma shi yana zuwa da a lot of complications. Za mu ga hotuna, za mu ga karin jawabi daga expert, saboda haka wannan mitin din yana da mahimmanci kwarai da gaske. Shi yasa Her Excellency the First Lady ta gayyaci masu ruwa da tsaki. Za mu ga cewa a lot of groups are invited here, saboda haka muna ma kowa da kowa maraba da zuwa, kuma muna fata cewa in Allah ya kai mu daga wannan akwai abubuwa da yawa da za a rika yi collectively. Za mu ji sauran jawabai as they come. Muna godiya da zuwa kuma muna lale maraba. Assalamu alaikum wa rahmatullahi wa barakatuh.
Marayu, ta Dikko Umar Radda, magana mama, Hajiya Zulaihat Giwar.
Thank you. Let's appreciate the Executive Secretary, please, once more. I think we are on course. I don't want this Rubella to turn into a revel where it is out of control. So we're on track doing the right thing, from sensitization to, rolling the vaccine to benefit the community as a whole. Having taken the welcome address, this time around is going to be keynote. I want to invite, I think, the immediate past permanent secretary of the State Ministry of Health, who is now the MRB coordinator, Northwest Zone. So join me to invite Dr. Kabir Mustafa to please proceed with the keynote address.
Marayu, ta Dikko Umar Radda, magana mama, Hajiya Zulaihat Giwar, mata mai ilimi ce.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Wa salatu wassalamu ala sayyidina Muhammad wa ala alihi wa sahbihi wa sallim. Your Excellency, the Executive Governor of Katsina State, Malam Umar Dikko Radda, ably represented by the Secretary to the State Government, Your Excellency, the First Lady, Hajiya Zulaihat Dikko Radda, distinguished personalities that are here, let me also align with the prolonged or elongated protocol by the MC. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. On behalf of Sea-Winds, I stand before you to present this keynote address, which I tagged a united front for a healthier tomorrow. Might be, before I go deep into the keynote address, I would want to call our attention to this preamble, a united front for a healthier tomorrow. We cannot do it alone. We have to put all our hands together to ensure that the information for this very valuable immunization program gets down to the nooks and crannies of our communities for the benefit that our communities will have from it. That is why we all have to unite together to ensure that this becomes something that we realize. Next slide. Let's project, please. I'm truly honored to stand before you today, filled with hope and unwavering determination as we embark on an urgent and vital mission to safeguard the health of our children and the generations to come. Today's gathering represents our collective commitment to the well-being of our youngest citizens, particularly as we advocate for the crucial introduction of measles and rubella MR vaccine in Katsina State. We must not forget the saying, prevention is better than cure, a principle that underscores the importance of immunization in preventing diseases that cause significant morbidity and mortality among our children. The measles vaccine has long been a cornerstone of our national routine immunization program, amongst others like DPT, HPV, polio, and yellow fever, etc. You have quite a number of them. Measles afflicting our children had been a cause of morbidity and mortality with antecedent complications, deafness, neurological sequelae, cataract, and a lot of others. However, it is essential that we expand this program to include the rubella vaccine, for rubella is very similar to measles, thus establishing a strong defense against two critical health threats facing our children, measles and rubella. This dual approach not only tackles the ongoing challenges of measles in our communities, but also safeguards our children from the various repercussions associated with rubella. Rubella, though often overlooked, possesses a grave risk, particularly to expectant mothers, with its antecedent disastrous outcome. The repercussions of rubella infection during pregnancy can be devastating, leading to congenital defects in newborn, including heart defects, deafness, blindness, and spinal abnormalities. By introducing MR vaccine, we are taking proactive measures to prevent these severe health complications and risk factors, ensuring the safety of children who are already born and those yet to arrive in this world. Your Excellency, the rollout of MR vaccine campaign is scheduled for October 2025, and I urge us all to rally behind this significant initiative. Our ambitious goal is to vaccinate every child aged 9 months to 15 years, striving for a remarkable 95% coverage within this age group. This guarantees conferment of herd immunity within our population. This initiative is not merely an objective, it is a matter of life and health for every child in Katsina State. To accomplish this, it is crucial that parents, caregivers, and all members of our society recognize the importance of this vaccine and actively support its acceptance. I will quickly take us through some slides to show what it is all about. What we are seeing here are 3 cardinal symptoms that come with the 2. That is cough, running nose, which we call coryza, and then conjunctivitis, red eyes. These are common features of presentation of both measles and rubella. Let's go to the next slide. Now, talking directly about the vaccine. The vaccine is a live attenuated vaccine that combines both measles and rubella antigens in it. Hitherto, we give measles vaccine at 9 months and 15 months. This has been the routine. So the routine is not going to change. It still be 9 months and 15 months, but there are 2 vaccines in one administration. So quickly, let's go to the next slide. The next slide, okay. Is it safe? Yeah, the vaccine is very safe. For the past 50 years, this vaccine, the measles vaccine, has been in use. And then for quality checks, it is based on the European standard. NAFDAC of Nigeria has done it and ensured that it is safe for us, and the customs also have cleared it. So these are facts that the vaccine is safe for us to administer. And then how serious is the vaccine? Does it have any complications? Generally, it has mild side effects of fever, rash, or swelling at the injection site, which are common. And then there is a robust system for any complication that might arise for us to be able to pick up if there is any unwanted reaction from that vaccine. Now, for who do we not give these vaccines to? Individuals with severe allergies to vaccine components or immune-compromised conditions. These are some information that we might need to take. Next slide. So the benefits. Why do we want to ensure that we cover this 95%? If we cover the 95% of that population, the target population, then we ensure that there is herd immunity. And once we have herd immunity, there is very likelihood that that disease will not spread within the community. So that is why it is so important. And for each dose that we give of this vaccine, it is less than $2 per dose. So it is something that can save a lot of lives, a lot of complications, and not too expensive if we consider that. Next slide. How do we justify it? Each year, we have an estimate of about 10,000 children that are born with congenital rubella syndrome in Nigeria, representing greater than 1/3 of the global burden. So it is important that we introduce it. Rubella-containing vaccine introduction will help eliminate the congenital rubella syndrome while simplifying measles surveillance. Nigeria will fulfill the criteria of introducing the rubella conjugate virus vaccine by achieving 80% coverage through preventive measles vaccination campaign over that period of years which are passed. And then population immunity profile forecast that every state in Nigeria will exceed one birth cohort of children aged less than 5 years susceptible to measles by December 31st, 2025, an indication for implementing SIS. What are we saying here? It has also already been projected that by 2025, we are vulnerable to measles disease in our communities. So how do we do that? The only way we can save ourselves from it is to get our children immunized. And through this special immunization activities, we'll be able to do that. And this is one of such activities that can put us through it. Now, for the campaign, what are we doing? We have the pre-implementation and then post-campaign activities. This very important day we are here today is one of those activities that are ongoing for the campaign. Now, quickly, let's look at the number of population that we are targeting. Next slide. For Katsina State, for the age group 9 months to 14 years, we have a total of about 4,044,501 distributed among the 34 LGAs that are supposed to be vaccinated during the campaign come October 2025, inshallah. So measles rubella vaccine introduction is for October 2025. Next slide. Campaign targets 9 months to 14 years. For advocacy, we have the Nigerian Government Spouses Forum leading with support from the National Primary Healthcare Development Agency, NCDC, NAFDAC, State Primary Healthcare Agency or board as may be, CWINS, Health Sector Reform Coalition, NOAA, Broadcasting Corporation of Nigeria, NOIPOS, Ministry of Health, Ministry of Budget, Ministry of Education, Ministry of Women Affairs, Ministry for Rural Development, and a lot of others. And then we need to finance this project, and then we need to have a focal person to support us. Continuing with my speech, I would like to take this opportunity to express my heartfelt gratitude to our esteemed traditional leaders and revered religious leaders. Your roles as educators and influencers within our community are invaluable. By championing this cause and sharing accurate information about the MR vaccine, you can help dispel myths and foster a culture of acceptance and encouragement. Your voices resonate across our homes, schools, and places of worship, guiding our community towards a healthier and brighter future. To our esteemed Governor, Your Excellency, we extend our heartfelt gratitude for your steadfast leadership. We also wish to commend Her Excellency, the First Lady, for her dedication to spearheading this monumental initiative through the Nigerian Government Spouses Forum and the Center for Wellbeing and Integrated Nutrition Solutions, CWINS. We want to emphasize that CWINS remains unwaveringly committed to fostering a strong, vibrant, and healthier community. Your dedication to the well-being of our children is not only commendable, but also deeply inspiring, encouraging us all to rally behind this noble cause. Thank you for your tireless efforts in championing this health of our future generation, Your Excellency. In closing, I want to emphasize that embracing the MR vaccine is not just an individual health decision, but a communal responsibility. We all share as guardians of our future. By integrating this dual vaccine into our routine immunization schedule, switching from single measles vaccine to measles rubella vaccine at 9 months and 15 months, we can significantly mitigate the morbidity and mortality associated with vaccine-preventable diseases. It is our ethical duty to ensure that our children are afforded every opportunity to lead healthy lives, free from preventable ailments. let us come together as a united front, wholeheartedly embracing and promoting the MR vaccine, not just to protect our children, but also to lay the foundation for a vibrant, healthy, and prosperous Katsina State. Thank you for your attention, your unwavering support, your deep commitment to this vital initiative. Together we can pave the way for a healthier tomorrow for our children, one vaccine at a time. God bless Katsina State. God bless our children. God bless the Federal Republic of Nigeria. Thank you. Assalamu alaikum. Na dawo don in ba da fassara ne cikin Hausa. Na manta a gurguje na ruga da gudu, ya kamata in dan ba da fassara abin da duk na faɗi a Hausa. Bisa ga wannan taro da muke da shi yau, wannan kasida da na bada kasida ce akan haɗa kai ga baki ɗaya don a tabbatar da lafiyar al'ummarmu. Wannan kuma ya zo ne bisa ga sabuwar allura da ake nema a shigo da ita, ko da ita wannan allura ba sabuwa ba ce ba. Allura ce ta maganin kyanda da cutar rubella. Kyanda ita ce ake ce ma measles, rubella kuma ita ake ce ma german measles da turanci. Amma a ƙoƙarin samun kalma guda ko suna guda na Hausa da za a kira ta, to abin har yanzu gaskiya mun yi ƙoƙarin samun kalma guda ba mu same ta ba. So ni a nawa sai nake kiranta ƙanwar kyanda. Me yasa nake kiranta ƙanwar kyanda? Saboda alamominsu kamar yadda za mu ji in aka zo bayani da su ƙwararru za su ƙare a kai, ba sa da bambanci. Sai dai ita ƙyanda ta fi fitowa da zafi ƙwarai. Ita ƙanwar ƙyanda, abin da sani ce mata ƙanwar ƙyanda, zafinta bai kai na ƙyanda ba, kuma kwanakin da take ɗauka, ƙyanda na ɗaukan kwanaki masu yawa, kuma tana kawo illoli da yawa ga yara. Amma ita ƙanwar ƙyanda da ta fito ba ta daɗewa sai ta tafi. Amma meye illar ita wannan kanwar kyanda da ake ce ma rubella? Ita wannan kanwar kyanda rubella, illarta tana zama da muhimmanci ne idan ta kama ko kuma mace mai juna biyu ta kamu da wannan cutar a cikin watanni 3 na farko na ɗaukan cikinta. Idan wannan abu ya faru, to ita wannan ƙwayar cutar takan sa abin da ke cikin ɗan tayin da ke cikin wadda ke da wannan ciki ya zama ya samu waɗansu matsaloli waɗanda sukan haɗa da kuramta, makanta, da kuma a ga irin lakka ko ƙananan kai a haifi yaro da wani ƙaramin kai, wanda abu haka dai wanda ba daidai yake ba da halitta da aka saba gani. To shi yasa ake ƙoƙarin za a yi gangami saboda wannan allura a shigo da ita, a haɗa ta da ita wannan ta measles da aka saba ake yi. Dama ita measles allurar kyanda ana yin ta a wata 9 da wata 15. To wannan gangami da ake so a yi na farko na a cikin watan Oktoba din nan, ana so ne a yi shi a tsakanin 'yan shekara 'yan wata 9 da zuwa 'yan shekara 15. Me yasa ake so a yi wannan? Idan aka yi wannan gangami tashin farko, duk wani wanda ya kamata a ce ya samu wannan allura to ya same ta. Daga gaba za a ci gaba da yin ta ga yara kamar yadda aka saba yi a wata na 9 da kuma wata na 15, saboda a tabbatar da an kawar da wannan cuta a bisa doron ƙasa, da kuma mu samu yara na gari. Kamar yadda muka sani, kyanda tana cikin cututtuka da suke addabanmu, kuma yara kwarai da gaske suna rasuwa bisa ga wannan, kuma suna samun complications daga ita wannan kyanda, wanda har yakan kawo su zama ba su iya cin abinci, su rame da sauran abubuwa haka. Wa'yansu kuma ma sukan kurance su ma daga dai ita wannan kyanda din. So a cikin dai babban bayani shine ita wannan allura ana so lallai nan zuwa ga watan Oktoba za a kawo ta a fara bada ta. Yanzu abin da muke gangami ne muke don mu ƙara wayar da kan mutane a fahimci amfanin ita wannan allura, saboda in ta zo a karɓe ta hannu biyu kuma a samu yinta. Muna godiya ga mace mai girma gwamna bisa ga hannun da ta bada na tallafa da tabbatar da wannan tafiya tamu ta wayar da kan al'umma ta shiga cikin al'umma gabaki daya. Muna godiya kwarai ga shi mai girma gwamna da ya ba mu ikon mu zo mu samu halartar wannan abu kuma a wannan gangami. Ina godiya ga dukkan manyan mutane da suka zo da kuma masu dafa mana wajen wannan aiki. Allah ya ba mu nasara, Allah ya sa a yi lafiya. Assalamu alaikum.
To Dokta mun gode. Ina ga wannan fasara ko kamus ai sai haka. Sako ya isa. Ana ta kokari a samo suna. To ga wani sunan. Bi iska. Bi iska. Thank you. I think before the good messages, I want in a special way recognize some of the dignitaries that have just joined. One of them is the Special Advisor to His Excellency on Health Tertiary Institutions. And sitting very close to him is the Deputy Chair of the Algon, the Executive Chairman of Danja Local Government. He has also arrived to join his colleagues that are here. And excuse me, not forgetting the main umbrella of the Medical Association, the NMA. In my established protocol, I've mentioned M1, so I want to be on the safe side so that NMA will not hold me responsible. They are all here. And there's also those from Form 1 and other interest groups, they're all here. So on this note, we will proceed with the good messages by partners. I want to appeal to our partners here to please kindly speak within 2 minutes for one at a time, and we want to give chance to a lot of partners that have stake in this music campaign to speak. I want to start first with the National Primary Health Care Development Agency. Alaji Mekudi. I think I have a well-established protocol, so if you like you sit or you stand on it, it's not going to break. So let's take the message straight, please.
Bismillahirrahmanirrahim. Your Excellency, the Executive Governor of Katsina State, the wife or the First Lady of Katsina State, Hajiya Zulaihat Dikko Radda, Honorable Commissioner for Health, ES, permit me to start with this new protocol. I'm here on behalf of National Primary Health Care Development Agency. It is a great honor and privilege for me to witness this very important gathering on the sensitization program on measles rubella vaccine introduction for the forthcoming catch-up campaign by Her Excellency, the wife of the Excellency. This signifies your unflinching and unparalleled support toward achieving better health care for Katsina State people through your various innovative initiatives to improve and strengthen primary health care system in Katsina State. Your Excellency, in line with the National Primary Health Care Development Agency's strategic blueprint, that is to streamline and integrate non-polio SIS to maximize the quality and also to reduce the outbreaks of vaccine-preventable diseases. The NPCDA is continuously striving for a future where no child dies or is limited by the harmful effect of measles and rubella infection. Hence, carry out these measures to introduce the measles rubella vaccine for the mass catch-up campaign to be held between 4th and 13th October 2025. As we all know that measles is a leading cause of death among young children in Nigeria. And Katsina State, as at week 15 of 2015, had the highest number of LGAs, that is 27 LGAs, with a record of measles outbreak. So, Your Excellency, this measles vaccine is being routinely given at 9 months and 15 months since 2019, with the introduction of measles second dose. Your Excellency, the rationale behind the introduction of Rubella vaccine, which is also known as the German measles, is one, to reduce the incidence of congenital rubella syndrome, one. Number two, to bridge the gap in those who have never received rubella. Number three, to protect a large cohort of population from 9 months to 14 years, and also to enhance the better seroconversion of the immune system. Your Excellency, for the ongoing activities for the Rubella vaccine introduction in Katsina State, MPCDA, in collaboration with Katsina State Primary Healthcare Agency and partners, had trained 238 personnel from the 34 local government that are now currently cascading the same training to other set of lower level personnel for the development of bottom-up approach micro plans and development of the micro plan across all the 361 wards in Katsina State. Your Excellency, measles rubella vaccination exercise will be carried out in 10 days plus 2 days more off at fixed post and a temporary or mobile post. So after the 10 days catch up, the MR vaccine will adopt the same measles vaccine schedule. That is the first dose at 9 months of age and the second dose at 15 months. Your Excellency, the aggressive mobilization and sensitization to our people at this time is crucial for the benefit and success of mass campaign intervention. So let's join our hands together to mobilize our families, friends, and the communities to receive the MR vaccine, which is very safe and effective. Lastly, I would like to once again express my humble appreciation to Her Excellency for her remarkable and extraordinary support to health sector in Katsina State. Thank you and God bless.
Thank you. Still, time allocated for good message still stands 2 minutes, please. WHO, representative of WHO.
Assalamu alaikum wa rahmatullah wa barakatuh. Your Excellency, the Executive Governor of Katsina State, ably represented by the SSG. Your Excellency, the wife of the Governor, Hajiya Zulaihat, all other dignitaries here present, please allow me to stand on existing protocol. I am representing my SC, WHO, in person of Dr. Abdel Nasser Adamu. As you know, measles rubella has been with us for quite a while, as the other speaker said, this sensitization is apt because the country has been witnessing a lot of outbreaks related to measles. However, we have little knowledge amongst the populace concerning rubella. And I'm very happy with what the panelist mentioned, that he has coined a name for rubella in Hausa, Kanin Kenda. Very interesting, because I remember one sensitization we also went, somebody did similar thing, he said Kanin polio as CVBTD2. So on behalf of WHO, I want you to know that WHO will always be there to support Katsina State. We have supported the Katsina State in terms of outbreak response. We've supported Katsina State in terms of trainings. We are supporting Katsina State in terms of surveillance. And so we'll continue to support Katsina State until the last mile. We're hoping that we will reach this 95% herd immunity, and by the grace of God, all the eligible children will be vaccinated during the integrated campaign. We want to thank you very much for the support. Thank you, and over.
Thank you, WHO. Next is the Deputy IM, the Deputy Incident Manager of the Emergency Operations Center, the EOC, Dr. Haladu.
Auzubillahi minash shaitanir rajim. Bismillahir rahmanir rahim. Your Excellency, the Executive Governor of Katsina State, ably represented by the SSG. Your Excellency, the wife of the Executive Governor of Katsina State, Hajiya Zulaihat, Dikko Radda. I would like to stand on the established protocol. I feel greatly honored and would like to therefore register my appreciation for the honor accorded me to give this goodwill message on the occasion of one-day sensitization program towards the introduction of measles rubella in Katsina State. Let me start by thanking Almighty Allah for giving us the opportunity to witness this very important occasion. I will also want to express our sincere appreciation and gratitude to His Excellency, the Executive Governor of Katsina State, for the priority attention his administration is given to the health sector. I will also want to commend Her Excellency, the wife of the Executive Governor of Katsina State, for the unwavering support and commitment to the health sector. Your dedication, determination, and distinction towards healthcare delivery in Katsina State is widely admired. I will also want to express our sincere gratitude and appreciation to the Honorable Commissioner of Health and Executive Secretary, State Primary Healthcare Agency, for giving all the partners a conducive environment to operate. As the previous discussants have mentioned, measles is highly infectious disease. In fact, almost every child who did not receive measles vaccine is likely going to have measles. One child that has measles is likely to infect 12 to 18 children around him. As mentioned also, rubella, the danger of it is congenital rubella syndrome. So it is a great opportunity for us to protect our children against these two diseases. I also want to express our sincere appreciation for the progress recorded by Katsina State government towards measles elimination. Our routine immunization data is showing that consistently we are at greater than 90% coverage for both measles 1 and measles 2. But this is administrative coverage. In 2023, there was a measles mass campaign, and I want to record here Katsina State is one of the states that has the highest coverage across the country. This sensitization is very important because the communities need to be aware, and Katsina State has this experience. In 2022 and 2023, new vaccines were introduced, Rota vaccine and human papilloma virus vaccine. But because we had a robust sensitization, Katsina State, I think, is number 2 in the country in terms of coverage based on the post-coverage survey. So I want to call on all the participants to continue to deliver this message so that our children are highly protected. African Field Epidemiology Network has been supporting Katsina State government. In February 2025, we trained over 300 local government personnel towards measles outbreak preparedness and measles outbreak root cause analysis. We also intend to cascade this training to the frontline health workers. And just this month in July, we have trained and conducted optimized outreaches across 10 consequential geographies, LGS in Katsina State, where we reach a lot of children with measles vaccine. So I'm sure Katsina State has what it takes when the vaccine is introduced to be the best in the country. With these few remarks, I wish us successful deliberation. Thank you.
Thank you, Kanobon Dr. Aladu. Next is UNICEF. UNICEF. Dr. Lukman.
Your Excellency, the Governor of Katsina State, being represented by the special guest and by the Secretary to the Government, and Your Excellency, the First Lady, Hajiya Zulaihat, Dikko, Radda, other partners here, religious and traditional leaders present here today. I bring you greetings from the Chief of Field Office, Rama Muhammad, who is not here today. So on behalf of UNICEF, I want to say a very good thank you for giving us this opportunity to partner with you in the state and also for organizing this sensitization. I want to say that UNICEF has been in the forefront of vaccine logistics and social mobilization. I want to say that we are ready to partner with the state to support the state in providing potent vaccines to every child in every community, and also to mobilize and support the state in social mobilization, engaging the communities. At the same time, I want to appreciate our First Lady for her dedication, for her support in improving the welfare of the children and mothers of Katsina State. I would say your effort has reached the people. And at the same time, UNICEF is also supporting the traditional leaders. And for all the traditional leaders here, I would say you are welcome, and I'm sure we are taking the right steps in the sense that we are already engaging you. We hope and we are sure we have 100% compliance within the communities. I would say that it is in our line as UNICEF to make sure that this vaccine switch from measles to MR is a successful intervention in the state and in the country. In line of this, I want to say thank you and for giving us this opportunity. I want to ensure the commitment of UNICEF to reaching every child and also in preventing all preventable deaths. So thank you.
Thank you, UNICEF. Tosai masuk ƙasa. Mai girma yadda ka zai sa albarka shi ma.
Bismillahirrahmanirrahim. Mai girma gwamnan jihar Katsina wanda ya samu wakilcin magatakardan gwamnatin jihar Katsina, mai girma mata gwamnan jihar Katsina kuma uwar gidan uwar Marayu ko? To ni ma zan tsaya bisa protocol din da aka establish by the MC. Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Na farko zamu yi Allah godiya da ya bamu dama muka haɗu yau kuma kamar dai da kowa sani duk wanda ya zo da wani abin arziki ai mu aka taimaka, mu ne 'yan al'umma, kuma al'umman nan duk abin da shahe shi ya sahi mu, saboda haka duk wanda ya zo da wani abin alheri ai mu yana tare da mu kuma muna tare da shi. Da na ce ba zan magana ba amma da aka ce sai na yi, to ina tabbatar muku da goyon bayan mu 100%. Ya Excellency, kamar yadda kika bukata yadda kika yi wannan, mu ma ina tabbatar miki da zamu yi kokarin mu tabbatar wannan sako ya kai ga al'umma jihar Katsina, ga kai har ƙasa inda ya kamata ya kai, kuma muna tabbatar miki da in Allah ya yarda zamu yi kokarin mu ga an ci nasarar wannan abu, an samu coverage na 100%. ai hakuri Hausa wani lokaci ta kaɗan gura-gura. Allah shi taimake mu, Allah shi mai da kowa gina shi lafiya. Mun gode, Allah saka da alkhairi.
To mun gode mai girma yan daka, ko babu komai kai ne chairman na State Social Mobilization Committee, inda baka sa albarka ba da an samu gibi. The leadership of Algon is here, especially the deputy chair. So I think it would be very apt if we give Algon a chance to make an input. So I want to invite the deputy chair of Algon, Honorable Rabo Tambek of Danja, to deliver his good message.
Bismillahirrahmanirrahim. Your Excellency, the Katsina State Governor, ably represented by His Excellency, the Secretary to the State Government, Barrister Faskari. Your Excellency, the First Lady, Hajiya Zulaihat Dikko Radda, the Executive Secretary, Primary Healthcare Agency, MD, Primary Healthcare, the PS, Ministry of Health, other distinguished guests, spouses of the 34 local government council chairmen, ladies and gentlemen, I want to start by appreciating the efforts of His Excellency, the Executive Governor of Katsina State, in addressing healthcare delivery system challenges in Katsina State. I want to inform this gathering, about 2 weeks ago, His Excellency was given an award in Lagos for his effort in addressing healthcare delivery system in Nigeria. This is a very remarkable achievement in the healthcare delivery system in our country. Her Excellency is also leaving no stone in addressing the challenges of healthcare delivery system, especially infant mortality and maternal mortality in our state that has affected the majority of our rural population. Your Excellency, Hajiya Zulaihat Radda, we want to thank you and appreciate your efforts. On behalf of the 34 local government council chairmen and their spouses, I want to give you our assurances that we will continue to partner with the Katsina State government and support all its policies and programs that will address the problems and challenges of healthcare delivery system in our state. I want to also guarantee our development partners, especially UNICEF, World Health Organization, and other agencies, that we will continue to partner with them and give them the maximum support that will take the Katsina State to the next level. We want to thank Her Excellency for organizing this workshop and being the founder and initiator of this one-day sensitization. Like I said earlier, this effort by the Katsina State government been done in view of the fact that Katsina State government is rated as one of the states that has the highest number of measles and rubella in Nigeria. But the government is doing its best in addressing these problems. I want to inform this gathering, His Excellency has renovated more than 2,500 healthcare facilities in Katsina State. And these healthcare facilities, out of the 361 wards, are being equipped with modern healthcare facilities, and they were also staffed. We want to thank His Excellency for these efforts, and we want to call the development partners to continue supporting Katsina State in addressing our challenges. Thank you, and God bless you.
Thank you, Algon. Now, Honorable Commissioner Moa, Minister of Women Affairs, is next.
His Excellency Dikko Radda, who's been represented by the SGS, Your Excellency Hajiya Zulaihat Dikko Radda, Founder, Chairperson of SASHIN, all other dignitaries, I acknowledge you. Assalamu alaikum wa rahmatullahi wa barakatuh. It is with great pride and sincere appreciation that I stand here to deliver this good message on behalf of Ministry of Women Affairs, Katsina State. Today's sensitization program on the measles rubella vaccine introduction is timely and life-saving. Rubella, also known as German measles, is a contagious viral infection. While it may appear mild in children, rubella is also extremely dangerous in pregnancy. In Nigeria, recent health reports reveal that coverage for the rubella vaccine remains below 50% in many states, putting countless children and pregnant women at risk. This new vaccine campaign aims to close that gap. Why do we need this vaccine? Because no mother should suffer the pain of losing a child to a preventable disease. No family should carry the burden of a lifelong disability that could have been avoided, and no woman should go through the trauma of preventable complications during pregnancy. This is why we applaud the Katsina State government under the dynamic leadership of His Excellency Dikko Radda for prioritizing health as a fundamental right for all citizens. The governor's ongoing investment in healthcare infrastructure, immunization drives, maternal and child health, and community engagement are a reflection of the clear mandate to protect the lives and dignity of every citizen, especially the most vulnerable. Your Excellency, the Ministry of Women Affairs remain fully committed to supporting this campaign through advocacy, grassroots mobilization, and public enlightenment. We call upon mothers, caregivers, women leaders, and civil society organizations to rise on this campaign and own it for their children, for our future. Once again, we commend Her Excellency for her visionary leadership, and we assure you of our continued partnership in promoting the health and empowerment of women and children across Katsina State. We thank you for your vision, we thank you for your commitment, and we thank you for putting women and children first in Katsina State. May Allah subhanahu wa ta'ala bless our efforts and protect the children of Katsina State and Nigeria. Allah wa ta'ala al-baraka. Thank you very much.
Thank you. Thank you, Commissioner of Women Affairs. Next, Honorable Commissioner M. Vase, Minister of Basic and Secondary Education.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Your Excellency, ably represented by the SGS, Her Excellency the First Lady of Katsina State, Hajiya Zulaihat Dikko Radda, Garkuwar Marayu, my uncle, Dr. Kabir, the MRV coordinator, representative of traditional rulers, Commissioner of Health, distinguished ladies and gentlemen, representatives of Primary Healthcare Agency, international partners, all esteemed guests, ladies and gentlemen, Assalamu alaikum. It's a privilege to address you today at this vital sensitization program on the introduction of measles, rubella in vaccination in Katsina State. I extend my gratitude to Her Excellency and the organizers of their tireless efforts to safeguarding our community. Measles remains a serious threat, particularly to our children globally. An estimated 107,000 people died from measles in 2023. Mostly children under 5 years, despite a safe, effective vaccination. In Nigeria, low vaccination coverage estimated at 83% for the first dose in 2023 has led to an occurring outbreaks with 297 reported cases in the first half of 2024 alone. Here in Katsina, past outbreaks have highlighted vulnerable areas with some affected local government areas impacted. Today we gather to raise awareness, dispel myth, and encourage every parent to embrace the life-saving intervention. The introduction of this vaccination is a critical step towards effectiveness of offering a robust protection. Today, we must raise awareness, address vaccine hesitancy, and ensure every child is immunized. I call on health workers, community leaders, and parents to collaborate, aiming for 95% coverage needed to herd immunity, especially in the hard-to-reach areas in Katsina State. I would also like to call on stakeholders to use the educational platform structures in about 2,900 primary schools and approximately 400 secondary schools across the state to reach out to children counting in millions to help eradicate measles in Katsina State. We at the Ministry of Education have been working closely with the primary health care, and we are open and all arms to this laudable mission in accomplishing this mission in Katsina State, inshallah. In closing, I extend my heartfelt thanks to all stakeholders for their support, dedication. Special gratitude goes to Her Excellency again, whose resilience and leadership have been driving force behind the transformative initiative. Together we can protect Katsina future, and God bless Katsina State. I'd like to speak a little bit in Hausa. I'll make an attempt. Jama'a manyan baki, assalamu alaikum. Ina muku maraba da wannan gagarumin taro, kuma muna godiya ga mai girma gwamna da mai ɗakin mai girma gwamna, uwar gidan shi Hajiya Zulaihat, da irin taimakon da take badawa a wurin taimaka ma kawo ƙarshen ƙyanda a Katsina. Ina son da Allah in kira iyaye wanda yaransu suke zuwa makaranta su bari su yadda su ba da gudunmuwa da goyon baya da yadda za a samu a yi maganin wannan cuta a jihar Katsina. Babu platform da take da yara a tattare a jihar Katsina kamar a makarantu. Muna da makaranta kusan 3,400 wanda babu inda za ka je ka samu yara a tattare kamar a makarantu. Saboda haka, stakeholders, World Health Organization, you're all welcome to partner with us and to work with us. Inshallah, we'll continue to do all that is needed to ensure that we eradicate measles in Katsina State. Assalamu alaikum.
Thank you very much. I think so much for good messages, and swiftly we'll be taking the next item, the expert panel discussion. At this point in time, I'd like to usher in the moderator of the panel. He is a public health physician with over 15 years experience, a fellow of the West African College of Physicians with special interest in epidemiology. He has a master's degree in public health nutrition, currently Assistant Director of Public Health in the State Ministry of Health, as well as the project coordinator of the Accelerating Nutrition Result in Nigeria. Irene, I'd like to hand over the microphone to the moderator who will take charge of the proceedings.
Bismillahirrahmanirrahim. Your Excellency, ably represented by the SGS of the state, the wife of His Excellency, Hajiya Zulaihat Dikko Radda, permit me to stand on the already established protocol. In the next 30 minutes, we'll be discussing on measles rubella vaccination in Katsina. And I would like to call on the panelists to please try to speak up in Hausa and English so that our participants here will fully understand the discussion that we're going to have. Let me start by introducing the panelists. The first one is Dr. Fatima Umar Tanimu. She's a pediatrician, a fellow of West African College of Physicians. She has a master's in public health and postgraduate in pediatric, both from Ahmadu Bello University, Zaria. Dr. Fatima, she's a seasoned clinician with over 10 years of world of experience in management of pediatric cases. She's currently working at Ture Umar Musair Adwa Maternal and Children Hospital, Katsina. She's a consultant and she's also involved in training of resident doctors. Please, can you come forward, Dr. Fatima? Please, let's appreciate her. Well, our next panelist is Dr. Muhammad Bashir. He's also a pediatrician with a fellowship from West African College of Physicians. Dr. Bashir Muhammad has held several leadership positions with successes at various levels of his primary, secondary, and tertiary education. Dr. Muhammad is currently a consultant at Federal Teaching Hospital, Katsina, where he served as a consultant and a focal person for immunization for Pediatric Association of Nigeria. He attended several trainings, seminars, and conferences at home here and abroad. Relevant among others was the recent training on immunization as immunization champion by Pediatric Association of Nigeria with the aim of creating awareness about vaccines, address vaccine hesitancy, and debunk misinformation and myth about vaccination. He has a lot of interest in research and training doctors. Please, can you come forward, Dr. Muhammad? The third person is Dr. Halima Abdurrahman. She's a fellow of West African College of Surgeons in ophthalmology. She was a senior lecturer in the Department of Ophthalmology, Ahmadu Bello University, Zaria, also a consultant to Ahmadu Bello Teaching Hospital, Zaria, before transferring her services to Federal Teaching Hospital, Katsina. She's currently the head of Department of Ophthalmology of Federal Teaching Hospital, Katsina. She trained on fecal and pediatric cataract surgery in Lagos and Ghana, respectively. She has also managed many ophthalmic complications of measles and conducted many pediatric cataract surgery due to congenital rubella syndrome. Can you come forward, Dr. Halima? The last person we have on our list is Dr. Nafisa Sani Nas. She's a public health physician with fellowship from West African College of Physicians. She had a diploma and master's in public health with focus on environment and health from London School of Hygiene and Tropical Medicine, London. Dr. Nafisa was a former assistant director, public health, State Ministry of Health, a former director, primary healthcare, State Primary Healthcare Agency, a pioneer supervising director of State Emergency Routine Immunization Coordination Center, SERIC. She has worked both at facility and community in the area of public health, including immunization. She has published a lot of papers on immunization and vaccination, presented a lot of papers in and outside the country where she served as a lead author. She's currently working at the Department of Community Medicine as a residency coordinator, where she's doing a lot of research on public health issues in Katsina State and beyond. Please, can you come forward, Dr. Nafisa? Well, like I said, in the next 30 minutes, we're going to be discussing on measles, rubella vaccination, as well as trying to sensitize stakeholders in the state for the upcoming campaign, catch-up campaign in October 2025. I have a series of questions for them. And also, with your kind permission, Ma, I want them to speak both in Hausa and English, as the case may be, because we really want our participants to fully understand what we are going to be discussing. Well, the first question I have is for Dr. Fatima. Dr. Fatima, please, can you share with us your experience with the burden of measles infection in children in Katsina State? And how do you think the measles rubella vaccine can help to reduce the burden of the disease in the state?
Thank you, sir. As a pediatrician practicing in Katsina State, the burden of measles infection is quite high. And then I've experienced firsthand the devastating effects of measles infection on the child, the family, and the community at large. For example, let me take you back to 2021/2022, just around the post-COVID pandemic. That was the time I returned to work with the state. And what I saw was quite alarming. You know, during the pandemic, there was poor uptake of the vaccine. So just immediately after that, we saw cases of measles presenting with severe forms of measles. When you receive the vaccination, you become immunized. So even with the vaccination, some children can come down with measles infection, but the one that you see in them is quite mild compared to the categories that are not immunized. Okay, for a child with severe complication of measles infection, they can have complications such as blindness, deafness. Yes, they can go blind.
Yeah, can you mix the information you are giving with Hausa so that our mothers can fully understand you?
Okay, I was going to just quickly do that after I finish discussing. So one child with severe measles with complication can come down with blindness, deafness, diarrhea, and with that he can easily tilt to malnutrition even if he is not malnourished. So from a measles infection, blindness, number one, deafness, encephalitis too can come in, and then malnutrition, the mother of all. Then that's one for the child. Then let's look at the burden of measles, simple measles that you don't need to admit the child. That child is prone to miss some school days, which will have an impact on his academic life. And then come down to the mother of that very sick child. She may have to miss her business post. If she is someone that owns a shop, she may have to close down the shop for some days. If someone that goes to the office, that will affect her life too, the father too. Then look at the financial implication. If you want to admit someone with severe measles, he may spend at least 1 week on admission. The cost of admission, I don't want to go into that right now. Then the overall, if there's a measles epidemic on the community now, the herd immunity of that community definitely will be reduced. Presentation has been done on herd immunity, all those things. Herd immunity means that someone is immunized. Let me take, for example, one child. So the risk of contacting measles in him is very minimal, which makes other children around him safe and subsequently the community. If you have a healthy community, the world at large, the nation will be safe. So that's part A. Then now, introduction of the MR vaccine will reduce all these complications that I've mentioned. That will be reduced. And if a child is healthy, he will go to school, achieve his full potentials, and all have you. In the end, the country will save money. The healthcare workers will not be overburdened with managing complicated illnesses. So in summary, bari in maimaita abin da na ce a gurguje da Hausa. As likitan yara da take aiki a nan a Katsina State, muna ganin cases na kyanda kala-kala. Akwai case na farko wanda amma yaro rigakafi zai iya samun kyanda amma ba zai wahalar da shi ba. Let's call it simple measles. Akwai case na biyu ba amma shi rigakafi ba ya samu kyanda za ta wahalar da shi. zai iya samun kurumta, zai iya samun makanta, zai iya samun ciwon taɓin ƙwaƙwalwa wanda har muna ce mishi Hausa suna iya cewa ai iska ya kama shi from ƙyandafa. Okay? Sannan kuma that's about the yaro. Wanda ya samu simple ƙyanda da baka kwantar da shi a asibiti ba, kun ga ba zai je makaranta ba. In yaro bai je makaranta ba dole sai mama ta zauna da shi ko a gida, ko kuma in tana da shago ba za ta je ta bude shago ba, in tana wani sana'a ba za ta je ba, in tana da office kun ga ita ma nan aikin ta ya tabu. Sannan kuma shi kanshi baba din wani kuɗin da aka aje na cefa ne za a kashe su wurin kula da yaro, sayan magunguna da sauransu. Sannan su kuma community din idan aka samu ciwon ƙyanda guda ɗaya, kun san ciwo yaro ɗaya na iya yada ƙyanda a duka a community. So idan aka samu wannan a al'umma, idan aka samu wannan al'umma kun ga karfin immunity ɗinta ya ragu, shine ake ce herd immunity. So me zai faru idan wa'annan suka faru? Za a zo asibiti, za a cika asibiti da marasa lafiya. Yaron da zai kwanta ya kwana 3 a kwance, idan mai complicated measles ya zo zai iya sati guda a asibiti, kun ga ya tare gadon kwanciyar sauran yara. Okay, wannan kuma da same yaro maman shi kun ga za ta tsaya da shi. In akwai wasu yara an bar su a gida, da same yaro kuma zai iya samun ciwon kwamiso, yunwa zai iya kama shi saboda satuttuka ba a cin abinci da sauransu. Sai ita kuma al'umma da su kansu ma'aikatan lafiya, kun ga wani yaro za a kwanta da shi a ce bai iya biyan kuɗin magani, sai a ce sai asibitoci an yafe mashi, kun ga su ma nan sun samu loss, sun samu asara. Sai kuma ita kanta gaba ɗayan community jiha ita ma ta rasa, gaba ɗayan Najeriya ta samu rashi duk daga mai ciwon ƙyanda. So me zai faru idan aka kawo MR vaccine din nan?
Yeah, we are coming to that later. I think
Okay.
you've talked a lot about and you share your experiences on infection of measles. We are still coming back to you. I think I will go to Dr. Bashir. Sir, please, can you tell us what rubella is and what are the symptoms, signs, symptoms, and mode of transmission, and how does it differ from measles? You know, from the previous discussion we had, there are a lot of similarities. Then how can you really differentiate a patient with measles and rubella? Thank you.
Good morning, everyone. Rubella, it's an illness caused by a virus, rubella virus. As has been mentioned already, it is very, very similar to measles. And most of the time, when patients or children come with rubella, we actually miss it. We confuse it with measles because they present with almost the same symptoms. The distinguishing features are that rubella is a milder illness. As has been mentioned already, Kanwan Kendako, so more or less like small measles, because when it presents in a milder form. It still presents with fever, cough, rash, and other features, but they are milder compared to measles. Most cases, most children or most parents do not even bring their children to the hospital when they have rubella because it's a mild form of the disease. A lot of parents just go to a chemist, go to an outpatient post, get some medications, and it resolves. It's usually mild in mild form. So the way to differentiate it from measles is the fact that it comes in a mild form. The child will still have fever, but the fever as compared to measles is very low. Measles present with high fever. This comes with low fever. In fact, sometimes the parents miss the fever. They just see the child with a rash. And the rash of rubella usually starts from the trunk. Most of the time they come, the chest, the abdomen, the rash is first noticed there. Unlike measles, where the rash starts from the face, the hairline, and begin to spread downwards. That of rubella begins from the trunk and then spreads outwards. So that is another way to differentiate rubella from measles. As we have said, in general, it is a milder illness. But the clinical importance of rubella is not the disease it causes in children, because as we already mentioned, it is a mild form of the disease. It is in pregnant women that the devastating effect of rubella comes, because when a mother is pregnant and she contacts rubella, it affects the unborn child. And it will affect every system in the child's body. They present with hearing problems, they present with vision problems, they cannot see, their brains are usually damaged, they have heart problems. Some of them have limb problems, they cannot walk when they are born. So unlike measles, measles does not cause these illnesses in pregnant women and unborn children. Rubella is the one that is notorious for doing this, and when the child is born with these conditions, the child is completely dependent on the people around him or her throughout his life, and that is why it is very important that it is prevented. How is rubella transmitted? It is transmitted as a droplet infection, respiratory droplets. Most children with measles or rubella, cough is an important presentation. So they cough, and when we cough, we suspend aerosols in the air. So people around us will pick up this infection, or even people that come much later after we have left. You don't necessarily be in contact with the person that has had measles or person that has had the cough. A few hours after the person has left, somebody else who comes into that same space can still contact this illness. So it is transmitted as a droplet infection, and is by respiratory droplets as patients with measles or rubella, they cough. What was the last part of the question?
Yeah, I think you've answered it. I asked you about the symptoms and mode of transmission and what rubella is. The only thing that I also want to ask is, you know, we talk about the 3 C's in measles, you know, the coryza, the cough, and as well as the conjunctivitis. Do we still have that in rubella?
Yes, we have all that in rubella, but as I mentioned, it is very, very mild, and most of the time they are even missed. The fever may be missed. The coryza is not as prominent as that in measles. The conjunctivitis, though, that comes because the child comes with watery eyes, redness of the eyes, and then, in fact, that may be the first sign that the child has rubella, because the mother just notices a child wakes up in the morning and the eyes are red. And then as the day goes by, the eyes remain red. Most of the time, people think, okay, he just woke up from sleep, so that's why the eyes are red. But then he refuses to clear as the day goes by. So that may be the first sign that the child has rubella. Yeah, so, but those cough and coryza are not as prominent in rubella as that of measles.
Yeah, thank you, Dr. Mohammed Bashir. I think I will move to Dr. Halima, who happens to be the only ophthalmologist here in the panel. My question is, what are the ocular manifestations of measles and congenital rubella syndrome in children, and how do they affect vision? How often do you see measles-related eye complications in your practice?
Okay. So measles and rubella can cause devastating ocular complications. So let's start with measles. For measles, let's
do the ingausa so that we don't have to go and come back again.
For measles, yana affecting ƙananan yara ne. So mostly a practice ɗinmu a nan wurin muna ganin measles idan aka samu measles complications in the eye, idan aka samu outbreak na measles. So every time akwai outbreak na measles, lokacin mu kuma muke ganin eye complications. So devastating complication in measles abin da yake causing yana causing abin da ake ce ma cornea din ido, wannan gilashin ido, wannan bakin da ake gani na ido, to eventually zai developing ciwo ko ulcer. In aka ce ulcer ana nufin gyambo, ciwo a jikin ido, eventually har ya sa ido ya perforating, ya rupturing. So idan muka ga wannan picture din, it shows a child with measles wanda in kuka kalli right eye din shi, cornea din is completely opaque. Compare it with his left eye wanda za ku ga black thing is black. But when you now look, you know that child is already blind in that eye. Let's go back to the first slide where the eye has already ruptured in that child. If you can see his left eye, the eye has rupturing. So most of the time, idan muka samu complications, the measles, haka a yara, our aim is to save the other eye. Usually, wannan eye then that will come is already gone. For those with milder cases that will just have corneal opacities, they will need to undergo corneal transplants, which we all know it's extremely expensive. And kuma ina ganin a Nigeria wurare biyu ne kawai ake corneal transplants, of which the post-op management corneal transplants in da yawa ba za su iya yi ba, and they end up in rejection. So that is for measles complications. So the number of cases we see of measles complication depends on the outbreak na measles da aka samu a state. So this da aka samu outbreak, we tend to get a lot of complications na measles. So let's go back to rubella. In case of rubella, that one is maternal to child transmission. Shine ke causing devastating eye and blinding complications. A lot of children come with what you call congenital cataract. Shi congenital cataract ɗin ana nufin yana ne na ido wanda aka haifi yaro da shi, tun san da aka haifi yaron da shi. Now, it goes beyond kawai a ce a zo a cire yana. Kamata yayi immediately ana gani a zo asibiti a cire, because as time goes by, within the first 1 year or even less, yaron zai iya developing abin da ake kira amblyopia, which means ko da an zo an cire, the child will still be blind in that eye. So let's look at the second slide, the second picture. Okay, pictures na rubella, cataracts, da nasa. So one, we see them quite a lot. No, this is glaucoma. So this is a 6-year-old girl that presented to my clinic. In fact, it's actually bilateral, but because it was in the left eye, you can see that in the black of the eye, there's a white. That is called a cataract. The girl has had it right from birth. Tana zuwa school, teachers keep on complaining cewa ba ta gani sosai, ba ta gani. Har sai da white in ya fito white sosai, iyayen suka kawo ta. And by the time they brought her, she was around 6 years, very intelligent child. Ana gaya musu cost din surgery. I mean, the father was like, ya haƙura. So dole aka samu aka tattallafa dai aka yi mata surgery. Very intelligent little girl. Next slide. So this was a child I saw in my clinic on Monday. So this is the extent to which we see every clinic day, we see 2 to 3 cases of congenital rubella syndrome with cataracts. Cataracts are the main complications, they're the main ocular complications, and then eye complications are actually the most common complications are congenital rubella syndrome. So this child, you can see it's bilateral, it's both eyes. So the child is almost 2 years and completely blind, of which parents then have been wanting to come to the hospital ba kudi until finally akatara. So, but by the time the suka zo, they might not even be on my list for surgeries. Har sai zuwa August suka samu, because I have a very long list of patients, and it requires special training for when there's in surgeries. Then, so this is one of the eye complications that ake coming up with congenital rubella syndrome. The next is congenital glaucoma, which is in the next picture. No, not that one. So there is what we call congenital glaucoma. Okay, this is one of my post-operative patients. He had bilateral cataract surgery, and this is after the operation with his glasses. Very happy child, he could see. So for congenital glaucoma is one of the complications on a congenital rubella syndrome. In congenital glaucoma, what the virus does is that it interfere in the formation na drainage system na ido, because constantly ana forming ruwa a ido, kuma constantly yana draining, so there has to be a balance between formation and drainage. So that virus now interferes with structures in drainage system na ido, and the child is born with glaucoma. It's usually very devastating, and the child is usually blind. I have a picture of a child that presented with congenital glaucoma, of which there was nothing we could do. We could just only send the child for rehabilitation, so the child could learn Braille and everything. Yes, there are surgeries for it, but usually by the time they come, it's too late. Well, the eye is already blind.
Yeah, thank you, Dr. Halima. I think I'll stop you there.
Okay, this is the child with congenital glaucoma from rubella. Thank you.
You see, the painful part of it is most of all of these conditions are preventable. And with the vaccine available now, we can prevent further occurrence of these diseases or complications of rubella and measles. Now to Dr. Nefisa. What challenges do you anticipate in introducing measles rubella vaccine in the community, and how do we address them? We know vaccines come with a lot of hesitancies, rejections, and what have you. Please, can you share with us, based on your experience, and then, you being a former supervising director of State Emergency Routine Immunization Coordinating Center, that what are the anticipated challenges that we may see while introducing this vaccine, and how do we address them? Thank you.
All right, thank you very much. So, like you said, it's only natural when you're going to have an intervention, you anticipate challenges. And the fact that there was a vaccine and there's going to be a change, people would ask questions, right? So what is more worrisome right now is the fact that, like you said, vaccine hesitancy the demand side factors. So caregivers would ask, what does it mean for my child? You know, where is it going to be an additional injection? You know, so allura ce rigakafi ne wanda an dan canza shi, an inganta shi kan yanda yake da. But the good news is an riga an san kyanda. And in as much as we are struggling for acceptance of vaccines, you know, ana ta cewa ana ta sa mutane, you know, ana ta kara faɗakarwa cewa rigakafi ya fi magani. This is an old adage, but it still stands strong. Rigakafi ya fi magani. So rigakafi ne an ɗan ƙara inganta shi. So mutane suna za su tambaya, so it's left for us now to say, wannan shi rigakafi ne an ɗan inganta shi ne, ba wai ƙara allura za a yi ba. An kawo rubella, kuma dai kun ga matsalolin rubella yadda take, kun ji daga bakin likitoci. So inganta shi ne kawai za a yi lokacin da ake ba da kyanda yadda muka sani haka dai ne. To kuma jihar Katsina is been proactive. Shi dai wannan rigakafi ba da aka ƙara da rubella ba gobe za a fara shi ba cikin wannan watan bane, ba wata mai zuwa bane, sai October. Amma Katsina has been proactive, you know, and it has involved so many other stakeholders, you know, traditional leaders, we have religious leaders, we have women affairs, education and all of that. We have a lot of development partners supporting this. So inshallah, abinda an dai saba yin campaign, I foresee that the fact that we have a lot of support and the fact that it's just a vaccine that is has been accepted. She measles vaccine yana cikin rigakafin da an fi an san shi a gaskiya. Kuma mata sun san kyanda, iyaye sun san kyanda, suna iya cewa wannan kyanda ne, suna ganin illar kyanda. So yau in aka zo aka ce kyanda dai ce rigakafin kyanda ne amma an inganta shi, I believe it's going to be easier for us to mobilize. Wata matsala da za ta iya fuskanta shine accessibility. Ya za mu kai vaccines ɗin nan ya kai har yaro da ke ƙauye, yaro da ke nesa. A jihar Katsina muna da wurare da ake kira hard to reach. It's not easy to reach them for several reasons. Kuma mun san yanzu yanayi ne da ake ruwan sama. Duk da dai na san by October maybe ruwa ya dan fara janyewa. Amma muna samun hard to reach areas in za a je vaccination, especially campaigns ko so me yasa za mu dan samu sauki, saboda an yi planning. Yanzu haka ana abin da ake cewa micro planning, kuma ba ma'aikatan asibiti kadai suke micro planning ba. Ma'aikata ne taruwa ake, akwai abin da ake cewa WDC, World Development Committees at the world level. Za a taru a zauna a ga ina za a je, me za a yi amfani da shi, mutane nawa ne, ina ne dama aka saba samun matsala. So zama ake tare da masu faɗa a ji, iyayen ƙasa da su religious leaders, da women leaders, youth leaders, da all of that. So mutane ne ake haɗuwa. Sannan kuma abin da yake da kyau shine idan an kai wannan vaccines din ma mutane, a dawo da feedback, a dawo a ci ma mutane, a celebrating successes together, a discussing challenges together. So insha Allah duk in aka yi duk za a samu nasara. Sannan in aka ce za a yi campaign ko za a yi vaccine introduction, kuɗi ne jiha take kashewa sosai. Kuma jihar Katsina ta fara wannan fidda kuɗi, an fara tattara resources, human resource, material resource. Dole sai an aje wannan rigakafin ya zauna a abin da muke ce sai an yi maintaining cold chain, sai ya zauna a cikin yanayin da idan aka yi ma mutum zai ba shi kariyar da ya kamata. So sai an sa su a freezer, kullum ana tada generator, ana in ba wuta. So kuɗi ne ake fiddawa sosai. So it's not easy. We thank the state for all they are doing and what they have done.
Well,
so,
let me stop you there.
Yeah.
I know you have a lot to say.
So thank you so much. And just to say that ba kyanda kadai bane, mu tare gaba ɗaya rigakafi tun daga haihuwa.
Yes, I also have the last question for you. Leave the mic with her. What role can healthcare professionals and other stakeholders, that's the traditional leaders, religious leaders, CSOs, play in identifying and addressing vaccine hesitancy or resistance in the community? And how do we address vaccine hesitancy among healthcare workers? You know, we have history of healthcare workers rejecting vaccines.
So that's quite wholesome. The fact that healthcare workers themselves, sometimes there is hesitancy within us. Akwai healthcare workers, akwai likitoci, akwai nurses, akwai CHUs, laboratory technicians, akwai different cadre in healthcare workers. So sometimes, you know, akwai natural thinking na mutane, sannan kuma akwai beliefs, akwai kuma understanding at different levels. So what happens is, we as amongst healthcare workers, we need as much as possible to be aware. Dama dai muna da wannan background din. A ci gaba sensitization, even within us, we need to be as, you know, and then data is very important. Data, share data, update, you know, updates na data. Menene duk kullum lokacin da aka yi gangami ko aka yi wani aiki za a yi collecting kamar ƙididdiga. Kamar yanzu, she has her pictorial data, ta yi showing and people see. So we keep updating ourselves, muna discussing. Sannan inclusion. Me nake ni da inclusion, duk wani abu da za a kawo wani intervention, since from design stage, everybody should be included. Every relevant healthcare worker, every relevant stakeholder will be included, from the design to implementation to the fact to lokacin da an gama za a evaluating a game, everybody will be included, all healthcare professionals, and as much as possible, convenience, bring these vaccines to where they can easily be reached. So research, again, in that research, include all relevant stakeholders. So it's really a problem, but then, ba mu kadai bane, ko a ƙasar waje ana samun irin haka. A ce akwai wanda su, they are thinking menene me yasa. So shi kan shi wannan vaccine din, akwai inda ba ma kadai rubella kadai aka sa ba. Kuma akwai yana da inganci, sun mai eliminating wannan measles din. Ba rubella kadai aka sa ba, akwai other vaccines together. An ƙara mumps, wa'ansu ma sun ƙara varicella, chickenpox, duk a cikin vaccine ɗaya. Kuma at one time za a bada shi, misali shot. So we just need to come together and continue to discuss all this. Inshallah, things will be better. Yeah. So, and then a very, very good, akwai iyayen ƙasa, akwai su the influence perceptions. You know, we see them as even ko mutum ya girme ka, ko ka girma mutum, you still, the traditional leaders are our father figures. So the influence perceptions, religious leaders are very, very important. They are special people, and beliefs are very strong. So when they speak, we tend to trust them. Trust is very important. Transparency, duk abin da za a yi, you know, that is why we're here. Duk abin da za a yi a faɗakar da mutane su gane. So even for like other stakeholders, before they can convince, they need to really, really understand and then trust us and then believe in whatever interventions are coming. Thank you so much.
I will stop you there. From what you said, you'll be the next person. From what you said, I understand that for us to reduce hesitancy among healthcare workers, we really need to engage them at planning stage and also sensitize them, as well as carry them along the issue of accountability, where she hammered on it a lot. I think we need to do that to reduce hesitancy among healthcare workers. Well, coming back to you, Dr. Halima, even though you've talked about it, but I still want you to be more specific now. How common is congenital rubella syndrome related to blindness or visual impairment in children, and what is your experience in Katsina?
So, as I mentioned before, the commonest causes of blindness with congenital rubella syndrome, shine cataract, yanan ido, da congenital glaucoma. Akwai other things which are not so sight-threatening. Now, in Katsina State, I have practiced in Katsina State since 2017, I think. So, I have seen countless number of children. I don't know how many. I have seen so many with congenital cataracts, with congenital glaucoma. So the burden is really high in Katsina State. I don't have the exact data, but from my experience working for the past more than 7-8 years, I know that it has very high burden. An average on every clinic day, I said I see more than two children with congenital cataracts. My theater list goes all the way to the end of the year. So it's a very severe thing, and then most of it comes bilateral. Duka ido biyun yake kamawa. Most, sometimes zaka ga ido daya amma mostly ido biyun ne. So shine wannan kan nan kuma cost din, the cost for surgery ido daya shima is very high. So zaka ga abinda ake so a yi da gaggawa saboda abinda ake ce ma amblyopia kada ya setting in, zaka ga parents suna ta dragging saboda ba kuɗin. So that's my experience working in Katsina State over the past 7 years.
Thank you, Dr. Halima. Let's move to Dr. Bashir. What are your thoughts on the effectiveness of measles rubella vaccine in preventing measles and rubella infection in children?
Measles rubella vaccine, and including all other vaccines, are effective in preventing diseases in children. Based on what we have discussed so far, the complications that the ophthalmologist has mentioned, we have seen that when our children are not vaccinated, they are going to be exposed to these complications. Our children are going to develop these complications. And the measles rubella vaccine over the years, we have seen that it's effective in preventing measles. And even those, as Dr. Fatima mentioned, even those children who have been vaccinated, even if they eventually develop the disease, it's usually a very mild form that most of the time they don't even present to the hospital. So measles vaccine has worked for us over the years. It's just that, of course, in pockets of places there have been poor uptake, and that's why we still continue to have measles epidemics. But then, where the vaccine has been well taken, it is effective in preventing the disease. And then now that we have incorporated rubella into it, it's going to go a long way in reducing all the complications, all the effects of rubella that we see. As we mentioned, the rubella itself in children is a mild disease. But then in children, in the unborn child, when the pregnant woman contacts this illness, the eye complications have already been mentioned. In my own practice, I've been in Katsina for the past 10 years, and we see over this time lots of children with the heart problems. Apart from the eye problems that has been mentioned, most of them come with heart problems. These children eventually may need heart surgeries, which they cannot afford, as she has mentioned. A lot of them come with what we call small head. And that small head, what it signifies is that the brain is not growing. That is why the head is small, because our heads increase in size, because the brain inside the skull is increasing in size. So when these children present with small head, it means that they have low level of intelligence. It means they cannot go to school and do well. A lot of them are even going around, they're convulsing because of the effects of that disease in the brain. So the measles rubella vaccine will go a long way in preventing all of this. And it's effective, it's safe. As has been in the keynote address, we saw that a lot of research has been done. So it's going to be effective in preventing all of these conditions that we have mentioned.
Thank you, Dr. Muhammad Bashir. Lastly, to Dr. Fatima, how do you think the introduction of measles rubella vaccine will impact the overall health and well-being of children in Katsina and Nigeria as a whole? You being a person that has been working in Katsina for more than 10 years, so to say. Thank you.
Okay, thank you. The introduction of the MR vaccine in Katsina State will go a long way in reducing these diseases associated with measles and also rubella. It will reduce morbidity. Ma'ana yawan ciwace-ciwacen yara zai ragu, kuma da yawan rashe-rashen mace-macen su shi ma zai ragu. Idan aka samu yara da aka babu ciwo a tattare da su, za su iya zuwa makaranta, su yi hidimomin su lafiya lau, families will be happy, community zai zauna lafiya, immunity din community din shi ma zai zama so improved. In the end, za a yi saving a lot of resources da ake kashewa wurin neman lafiya. Sannan kuma yara za su girma su cimma abin da ake so su ci. Sannan kuma all those complications da aka nuna na ido da yara za su iya samu daga ciwo, su ma duk ba za a same su ba in aka karba in aka kawo wannan immunization na measles a Katsina.
Thank you, Dr. Fatima. Please, can you give it to Dr. Bashir 1 minute for him to summarize his last few thoughts about it?
Thank you very much. I just wanted to add something important about the initial question about addressing vaccine hesitancy. As someone in the last 1 to 2, 3 years, we're working, we are trying to create awareness for vaccines. We have used several strategies in trying to increase the uptake of vaccines in our communities. One of the most important strategies is for all of us as community leaders, as healthcare workers, as important personalities in communities, to act as role models. What do I mean by acting as role models? As healthcare workers, a doctor, for example, if I present my children to be vaccinated in front of the whole community, that will engineer them, that will motivate them, that will show them that, yes, this vaccine is safe. This vaccine, all children should have it. So all of us as healthcare workers, community leaders, traditional leaders, when we present our children to be vaccinated, when we show them that these vaccines are safe, when we show them that we're not just asking you to take your own children to be vaccinated, we're also bringing our own children, then you are telling them it is safe, you are telling them that, yes, it is worthwhile to carry out this exercise. So that is the message I wanted to add to this, that yes, all of us here, we should take this message back home. And when the vaccine is eventually introduced, we should present our children to be vaccinated. And then let everybody around you see that your own children have been vaccinated, so their own children will also get vaccinated. Another important aspect of this is the use of social media. Currently, it is the norm of the day. Most of our young people on social media. Social media is an effective way of creating awareness about vaccines and addressing vaccine hesitancy. We all have social media handles. When this vaccine is introduced, or right from now that the campaign is going to start, let us begin to influence people's thoughts using our social media handles. It's another effective way of creating awareness about vaccines. Thank you very much.
Yeah, I think with this, we've come to the end of this session. Please, we can appreciate the panelists as well as our chief guest host for hosting us and giving us the opportunity to discuss this very important topic of the day. Thank you. Can we have a group picture?
So, this is a special photo session. So panel bangaren hoto dai mun sallame ku. To bayan tattaunawa da aka gabatar a daidai wannan gaba akwai wasan kwaikwayo da za a gabatar amma dai takaitacce. Akwai bangare biyu, akwai dalibai na Kasim Kofavai School of Nursing da kuma na elite jama'arsa. So zan fara da dalibai. Students, can we have you for your drama presentation? Now time for drama presentation. I think we have two presentations. The first one that we are about to witness is a play by students of Late Kasim Kofavai School of Nursing, and then after them the Nelly will also come on stage. Kai, 'yan mintuna hake gare ku. A ba su kujera.
Assalamu alaikum wa rahmatullahi wa barakatuh. Her Excellency First Lady Hajiya Zulaihat Dikko Radda, members of the high table, audience, good day to you all. As you can see us here before you, we are students from Katsina Bay College of Nursing Sciences. We are here to present a short drama on awareness of measles and rubella vaccine. This drama will going to be performed in Hausa language for effectively treat local level. We really appreciate for this opportunity to contribute health education and awareness to our community. Thank you very much. Yawa, wannan drama za ta kasance a garuruwa guda biyu. Ma'aikatan lafiya za su zo a wannan gari mai suna Gorawa. Bismillah.
Assalamu alaikum wa rahmatullah. Allah ƙara wa mai garin Gora lafiya. Mai gari ina kwana. Masha Allah. Da fatan mun same ka lafiya tare da kai da mutanenka. Kamar da farko dai sunana Nas Buhari Ilyasu, ma'aikacin jinya da unguwar zoma, da kuma abokin aiki ta
Nas Fatima Zakariya.
Da abokin aiki na wanda muke aiki tare.
Nas Abdul.
To, mun zo ne a ma'aikatan jinya da unguwar zoma da muke ba da kulawa ga yara ƙanana ga allurar rigakafin kyanda. Wato, ka san akwai wata cuta wadda ta taso kwanan nan wadda dama can an santa, amma menene ciwon yana ta hauhawa na wanda yake kama ƙananan yara. So, akwai allurar da aka kawo wato wadda ake ce ma allurar rigakafin kyanda. To wadda muke so mu gabatar da ita ga wannan gari wato garin Gora. Saboda haka mai gari muke so a bamu ranar Alhamis gobe insha Allah mu zo mu gabatar da wannan allura ga mutanen gari.
Ku fa daman wa'annan masu cukakken wanda haka kuke. Yanzu kai zaka ga mai gari ranar da zai baka ko dai mai gari ne zai ga marar da zaka zo.
Allah ƙara ma lafiya san kira. A bamu duk lokacin da ya kamata insha Allah mu kuma za mu yi kokari mu zo mu gudanar da wannan aiki.
To shin wai ta wannan wace kalar allura ce kake nufi?
Allurar kashe mutane mana.
Okay, irin wadda aka yi ma wannan yaron dan gidan Malam Ayuba?
Mana gashi na yanzu ya zama gurgu.
Gaskiya mu mai gari ba mai shirya wannan al'amarin ba.
Mu ga mu da ba a yi mai ita ba gashi maganin sassaƙe muka sani mu je a sassaƙo marke mu sha shine kawai abin da muka sani.
To gaskiya mai gari tsakani da Allah mu wannan mutanen ba mu yadda da su ba, maganar gaskiya.
A ku ba su dama mana tunda dai sun roƙe alfarma ku ba su dama mu gani za mu sa musu lokaci da ya kamata su zo in mun tattauna tsakaninmu da mutanenmu shine.
Sankila kaga magana ta fito ko in aka ce a aya ce kamar magana na gaji.
Mu gaskiya sarki ba mu yadda da wannan al'amarin ba mai gari tsakani da Allah ku kun yadda? To gaskiya abin na tafiya da jama'a ne ba dan kana mai gari ba tsakani da Allah mu ba mu yadda da shirin nan ba. Gaskiya shirin nan naka ba kyau gare ba.
A Sankira daga musu kafa yanzu dai Sankira za a ba su rana.
Allah taimaki mai gari. To shikenan dai. Kinda mai gari ya matsa mu dai ba dan muna so ba dan ni ko kallon ku ban sanyi gaskiya dan tsakani da Allah bai yiwa ku gurguntan mamu da diya mana ji muna gani kinda ya matsa ku dawo ranar talata ya za a yi.
Muna godiya Sankira, Allah ya kara mai gari lafiya.
Yawwa to wannan shine fita ta farko da ma'aikatan lafiya tsakaninsu da 'yan garin Gorawa. Sannan sai gari na biyu su ne garin Takatsaba. Likitoci za su zo domin su gabatar da kansu.
Assalamu alaikum wa rahmatullah. Ran kashi daɗe mai gari, barka da yini. Mu da kuka gan mu na malaman lafiya ne wanda muka zo daga ma'aikata lafiya. Tare da ni akwai 'yan uwana wanda kuka fi sani da malaman jinya da kuma na anguwar zoma. Mun zo ne wannan gari naku saboda mun san cewa baku da access da asibitoci, baku da asibitoci a kusa. Akwai wata cuta wadda ko iyaye da kakanni mun santa, wato kyanda. To tare da kuma busa iska. To shine muka zo muka ce muna son mu zo garinku saboda muna son mu haɗa wani program akan wayan maku da kai akan cutar da sign, za mu gaya maku sign da symptoms da ake gani da idan aka gansu za a yaro yana da wannan cuta. To kamun zuwa wannan ma muke so akwai wata vaccine wadda mai girma gwamna na jihar Katsina wanda suka samo ta suke so za su zo su dinga yi ma yara na jihar Katsina 'yan wata 9 da kuma 'yan shekara 14. Za a zo a masu domin kare su daga wannan cuta ta measles da kuma rubella kenan, wadda kuka fi sani da kyanda da kuma busa iska. To insha Allah mai girma muna son ku hidda mu lokaci wanda za mu zo domin mu wayar maku da kai, sannan kuma ita wannan vaccine in tana nan za a kawo ta a cikin watanni 3 nan masu zuwa domin mu zo a yi ma yaran ku, kuma ba za a baku a baya ba kasantuwa baku da asibitoci a kusa da ku.
To mai gari ka dai ji hudodinsu da abubuwan da suka zo da shi, amma ni dai mai gari ta bangare na ni dai gaskiya ban yadda da wannan tsari da suka zo da shi ba, saboda jiyan nan akwai diyata da ta dan tashi da dan masassara, sauya kawai na jika mata ta tashi, amma dai ban sani ba mai gari, Allah ya kama lafiya, ban san ya za ka yi ba, ban san wani irin mataki za ka dauka ba.
Mai gari bai kamata mu yanke hukunci da kanmu ba. Na ji an ce akwai 'ya'yan gidan Malam Bala waɗanda suke makarantar kiwon lafiya da ke jihar Katsina kenan School of Nursing. Yanzu mu samu a kira mana su don mu ji daga wurinsu, don na san ba za su bari a kawo mana abin da zai cutar da mu ba. Sadiya, je kira mana 'ya'yan gidan Malam Bala, ki ce mai gida na neman su yanzu.
Mun samu zuwan wasu baƙi yanzu ma'aikatan lafiya, muna neman mu ƙara jin bayani akan abin da suka zo mu da shi na wata rigakafi na kyanda da kuma busa iska. Muna so mu ji daga bakin ku domin mun san za ku samu ilimi akan abu.
Assalamu alaikum rahmatullah. A farko dai mai gari, wannan abin da suka zo da shi abin farin ciki ne kuma abin murna ne, sannan abin ci gaba ne ga al'ummar wannan gari. Duba da ni da uwata da muka yi karatu na lafiya a makarantar Kasum Kofar Bai School of Nursing Katsina, mun ga amfani wannan rigakafi sosai, saboda a baya ana samun mace-macen na yara da matsalar huhu da masassara da makanta, duk yara suna faruwa da ita. To cikin ikon Allah da kuma taimakon gwamnatin jihar Katsina ta kawo magunguna da alluran rigakafi wanda ake ma wa'innan yara, na ana rage mace-macen yaran nan da kuma ciwuka da suke samu. Sannan akwai wata kungiya ita ma ana ce mata Safe Space Initiative, wadda akwai wata kungiya wadda ana ce mata Safe Space Human Initiative, wadda take taimaka ma yara, tana ba su magunguna da kuma alluran rigakafi saboda a kawar da wannan cuta. Sannan kuma ita wannan cuta ba wai yaran kaɗai ba ne ba, za a idan aka yi ma yaro ɗaya kamar an taimaka ma al'umman ne gaba ɗaya, za a rage yaduwarta, sannan ga uwata ita ma za ta ƙara bayani.
Ranka ya daɗe, wannan ba ƙaramar dama ba ce ba aka samu, sabida duk wannan magungunan da za su zo su kawo mu su idan aka bincika kyauta ne, sabida gwamnatin jihar Katsina ta shirya sosai sabida ta taimaka, sabida yawan mace-macen da ake samu. Kwanakin baya an samu wa'anda wannan cututtuka suka sa suka zama kutare, wasu kuma suka mutu. To idan aka amince da wannan abin gannan da suka kawo mu za mu samu ci gaba sosai, sannan duk mace-macen da muke samu cikin ƙauyen nan namu za su gyaru. Kuma abin farin cikin mu ne nan gaba ƙauyen mu za a ce gashi shine wanda ya zo na ɗaya, saboda mun karɓi abin da gwamnati ta kawo mu hannu biyu.
In haka ne to za mu anshi wannan abu 100% za mu ba da goyon baya, kuma insha Allah duk gudunmuwar da ake bukata daga gare mu za mu bada. Mun ba ku gobe in Allah ya kai mu ku zo a fara wannan rigakafi. Mun gode.
Allah saka da alkhairi. Yawwa, bayan kamar shekara 2 likitoci wa'annan 'yan wannan gari sun yadda an yi masu wannan vaccine din, su kuma 'yan wannan gari sun bijire sun nuna su kwata-kwata ba su san a yi masu wannan vaccine din. So bayan shekara 2 za mu ga menene sakamakon duka al'umma biyu din.
San kira wai ina likitocin nan, gaskiya ina da bukatar ganin su sosai, a je a kira min su, ai sauri a kira min su.
Yanda ka ce ranka da insha Allah.
Assalamu alaikum. Allah ya kara mai gari lafiya. Allah ya kara mai. Ina yi ne mai gari? An yi lafiya. Ya kuma mutanen gari. Masha.
To, abinda ya sa sarki ya ce a nemo ku shine gaskiya bayan tafiya ko abubuwa da yawa sun faru. Gaskiya. Amma abinda muke so mu tambaye ku shine shin wannan cuta da kuka zo ka gaya mana ya ma sunanta?
Cutar kyanda ko kuma a ce bi iska.
To, mu dai mun ji tun iyaye da kakanni ana cewa ana yin wata cutar kyanda wanda kuraje ke fitowa, ita ce? To gaskiya an ce har kabari ana yi, kaga mu shi sa mu ɗauki abin da muhimmanci ba, saboda an ce in mutum bai yi ba a cikin kabarin shi zai yi, kaga an kai cikin kabarin ka shikenan falallahi alhamdu ba wani abin da zai faru, ko ba haka ba? To gaskiya mu dai ba mu san da cutar nan take ba, shin yanzu aka iya gaya mun mutanen irin mutanen da ke kamuwa da cutar, kuma ita cutar ya take, menene alamomin da za mu gani a jikin mutanen mu gane cewa suna da wannan cuta?
To Allah ya kara masan kira lafiya. Ita wannan cuta ce wadda ta fi kama ƙananan yara, mafi yawanci ma tana kama yara waɗanda suke ƙasa da shekara 5. To idan ya kasance mutum ya riga ya kamu da wannan cuta, za a gan shi da alamomi kamar haka. Za a ga ya fara da zazzabi, sannan sai ga idanun shi suna kwantsa, idanun shi sun yi ja, yana yawan tari, kuraje za a ga sun fara ma a jikin fuskar shi, sai su game jikin shi gabaki daya. Wa'annan su ne alamomin da zaka gane cewa yaro ya kamu da wannan cuta. Shi yasa kullum muke gaya ma mutanen al'umma cewa su rinka kai yaran su da yaro ya kai wata 9 a kai shi asibiti domin a yi mai allurar rigakafin kyanda kada ya kamu da wannan, domin an ce rigakafi ya fi magani.
To gaskiya mai gari in dai haka ne wannan yaron dan gidan Malam Idi abin da ya kashe shi kenan, saboda kaga soyayyen da muke jikawa muna ansowa wurin Malam Garba, kaga dai ba su yi amfani ba, ko ba gaskiya ba? Amma dai kai mi zaka iya cewa? Kaga yanzu irin abubuwan da ya faɗi yake cewa irin su in dai su ne alamomin a ga idan mutum na ruwa da dai irin sauransu, kaga tsakani da Allah to wannan yaron ma na gidan Atika ka gane shi? To gaskiya irin ciwon kenan, ba zai hana mu kirawo Atika ta kawo yaron nan a duba shi koko?
Ba matsala, ai sauri a je a ɗauko yaron nan, sannan zan yi wa Malam Idi magana. Wannan sai wadda ake sassaƙowa da su hannu da su waye an daina ba da su a garin nan. Da yaran mu sun samu matsala mu tafi asibiti, maza a tafi asibiti.
To ai in dai haka ni ma yanzu haka ina yaro na yana gida yana ta fama da tari, idan shi na ga yayi jajjajajja, kuma sannan naji an ce wannan alamomin cutan akwai jan ido sai tari, sannan yaron nan yana yawan atishawa. Haka ne me zai hana mu kawo shi domin a duba shi?
Allah ya ƙara lafiya. So yanzu mun ji duka matsalalu da aka samu a gidaje daban-daban, saboda haka duk yaron da yake da wannan cuta a yi kokari a kawo shi asibiti ko kuma cibiyar lafiya da take kusa domin ba shi wannan allura ta rigakafin kyanda.
To san kira a ba likitoci kaji, a ba su zabi, a ba su awaki, kai a ba su shanu, a ɗibi komai a ba su.
Allah taimake ka. To ku gaskiya muna alfahari da dawo ku da kuka yi, kuma muna masu baku hakuri a bisa abin da ya faru wancan da muka yi muku last time da kuka zo, saboda mu ba mu sani ba, ko ba gaskiya ba. to daga baya ne jawabi da bayanai suka dawo mana cewa haka. Mun gode, Allah sa alkhairi.
To mun gode, a taba musu.
Mai gari lafiya da san ira da mutanen garin shiga ke da muna godiya mai gari.
To a taba musu.
To assalamu alaikum.
To mun gode. In ba a baku kaji ba a baku kajiji. To mun gode kwarai, sako ya isa. Duka dai masu garin guda biyu ba rawani. To ina Nelly?
Ai na rantse da Allah tunda na gaban ka yarinyar nan fa insha Allah kauna ya daukan man yarinya ya tahiya kai ta a kire man ita yo haka ake yi abu da mun riga mun saba iyaye da kakanni har dai a jika kan damo a kawo kan kihi a jika a radi in dai kaga ba a warke da kanda ba to ba a bashi ya tsutsa ba
Joni ma mi war take hutsange to
Allah sarki dan asi radu ka kai man ita di an kire man ita na yalli di an kire man yarinya
ke waya akai da muka je
ha ba ne yalli
ai ba zafi allura ko motsi ban yi ba sai da likitan ya taba ni ya ce yan mata kin yi daidai kuma mutum in ba ya mai ba zai iya kamuwa da cutar kyanda kuma kyanda ta iya sa mutum ya makance ko kuma ya kurmance har mutum ma yana iya rasa rayuwa.
To kin ji.
Na ranke da Allah na ji kunya ai yarinya karama ne.
Ni da ma na ji an she daga dan wata tara zuwa dan shekara 14 ake ma. Shi yasa ni she a tare ita. To bayan wannan tsaki ya da Allah mu wannan jihar sai mu ce mun gode ma Allah. Ina giwa gwagware.
Allah sarki garkuwan mu kenan marayu ne.
Billahi tsaye take kamar hakori. Saboda mi bai yiwuwa ta ce mai gidanta yana tsaye yana taimaka ma al'umma ita ta zanna.
Bai yiwuwa ne.
Lokacin da aka yi wannan shi wannan nawa wannan
sikila ne yalli.
Sikila ba gidauniya gare ta ba ma.
Ni shedil aradu ni shedil.
Har makwabta kasashe ba su zo suka taimaka ba.
Suna shin arziki har gobe ne. Wallahi tallahi.
To kuma tsaki ji ai dama don alkur'ani da yake na dan koyi turancin kadan aka ce
to ka dai hankali na rike da Allah
wallahi bai aka ce
sarki turanci tana nan
behind every successful man there is a woman ko ba haka kashe ba
to ban sani bane igoro
mun gode ma Allah jahannan duk inda ka taba lahiya launi da mai girma gwamna da mataimakin shi da suka taimaka mai girma gwamna ya dauki mabudi ya ce ina sakataren gwamnati an shiga mabudi da ya dawo maka aka bude littawai shi kai wallahi ba sai na ji ba na sa amana gare ka yau ko lokacin da kai mataimakin gwamna ai lahiya launi
amana ai hai dan amana ne yalli
to ni yanzu za ni tai wurin gangami
to
kuma
to yalli ai ba kai kadai ba
kuma ubana na nan alquran ya zo kin san sai na go gaisuwa
yan daka ko
yawa kin gane
Allah ai kulli waɗi kake ne li amma na ranke da Allah ni na san ba yadda za a yi baka ka ƙara aure ai duk wannan ɗinka kenan ka je ka yi maka mata
alƙur'an baki isa ba kin san abinda kin san wani bature na Ingila da ya zo billahi lazi da ya ji wata kwamishiniya ta harkokin mata tana buga turan shi ya diba ya kai shi hey wonderful alquran ko shi ya zo ko shi wurin albarka billahi to ni zan ta wurin
to ne yalli na she
ke ki je ki sha abinci wushe ki je ki
sha ki je ka san fara nan ki dauka ki dauka ki na sheshen zaka je to ai ne yalli ba kai kadai ba ni kai na shiga zan yi lungu da sako ne yalli mutane irin mu waɗanda ba su fahimci abin da aka nuhu
wannan abin tsaye ake wallahi
kaga dai mu da yadda muka sani kan kurege ne na yalli da kan kihi danye a cika shi ya tsutsa bu ba yaro ya sha ko to yanzu za mu shiga lungu da sako in Allah ya yarda mu faɗakar da mutane ga
ke na ma manta da wani sako
to
ina yan school of nursing ba su nan ne wai yawwa ina nan labe naji ita matar gwamna giwa gwagware ta ce waɗannan yara Allah sa ku shi jarabawa Allah sa ku fanshi waɗanda suke to ni dai haka na ji tashe
to a
da wallahi nake jin tana cewa
to Allah kiyaye na yalli
wai ni Allah na rasa inda zan sa kaina ni yanzu wannan yaro na rasa yadda zan da shi ga shi dai ga yana ta fama da ciwon kai ya ki sauka ga ido na zuba ga hanci ga mura ga masassara kuma ne
Muhammad na Muhammad
haba wani Muhammad na Muhammad
wani yau na ga kamar amma mutuwa
hankali na tashare na ya mutse fuska ta akwabe
ina kan hanya ai naji kana magana yaron ka da bai lafiya to wai Muhammad
yaro ne nake ta hama da shi cikin gida mutuwa ma ta mai hutu
to wai Muhammad zo ka ji ka dauki yaron nan ka kai shi asibiti ka dan a duba shi
ayo wani asibiti wanda muka gaji magani kaka da kakanni nan akwai kanwa kakata nan in ka haye dan tudu na an so mashi yan abubuwa yan jike-jike amma da yaron kullun dai gashi nan dai yanzu sai ne magana uku yake ji kuma in ne haka bai ganin kirki
to bari in gama Muhammad wannan alamomi suna nuna alamun yaron nan yana da ciwon kyanda amma shawarar da zan baka shine ka kai shi asibiti mafi kusa domin a duba shi in ce kana ganin irin kokarin da gwamnatin jihar nan take ta kowane bangare musamman a bangaren lafiya wanda yana ɗaya daga cikin ƙudurin mai girma gwamna na cewa kowace ƙaramar hukuma sai ta samu likita ɗan wannan ƙaramar hukuma don kula da lahiyar al'umma aka ɗebi yara 'ya'yan talakawa aka kai su waje domin su je su karanto aikin likita bayan wannan mai girma gwamna ya zanna da masana akan lahiya aka ce ya za a yi a inganta ƙananan asibitocinmu da ke birni da ƙauyukan jihar nan wanda dr shamsu sai da ya zagaya asibiti 138 da mai girma gwamna ya gyara ya inganta sannan ya samar da magunguna a cikin wannan asibitoci bayan nan mai girma gwamna da kanshi ya ƙara tabbatar da akwai bukata a ƙara inganta wasu asibitoci wanda yanzu haka ya ƙara ba da guda 110 ana nan ana cikin aikinsu
kai za gama billahi lazi in kace za ka tsaya faɗin aikin na alheri wanda mai girma gwamnan jihar nan malam ya yi Allah daga nan sai mu kai mangariba baka
kahin nan ita kanta uwa tamu wallahi kullun tunaninta duk abin da ta san za ta kare 'ya'yanta daga wani ko cututtuka ko wata tarbiyya ko wani abu shi take kokarin ta aiwatar da shi a cikin jiha yadda take son 'ya'yanta ta haihuwa cikin ta wallahi haka take son al'umma yan jihar Katsina ka duba an ce kwanan nan
ba ma wajen lahiya kawai ba damina ake shigi ba
damina
dan kama ba samu ambaliyar ruwa ba
an samu
gidaje wajen 74 ya rushe alƙur'an ina hukumar nan ta bada agajin gaggawa ta hajji abin ta dan gani wallahi sun je mai girma gwamna ya ce a buruta duk abin da ke nan shi bai son abu ya faru bai taimaki talaka ba
to aka ga bari ga wata dama ta ita Muhammad tamu yanzu haka tana ta jan ita Hajiya binta kawa da an ce yanzu za ta duba sai a ce duk abin da za a yi ta kokari ta ga mata sun yi samun kaso da mai tsoka
wannan haka yake to wai ni yanzu tsaya ka ji ni hoda ma ka san ina hoda kala'i guda daya ka san shi kala'i ba wurin sallah ba har wurin ganin mutum qur'ani in ba ina da kala'in ganin sakataren gwamnati ba shi ke
so nake a kai ne in je yi ma mama godiya
kima
mama godiya
oho akan wannan tallabi na allura da aka yi maku to insha Allah za a kai miki to me za ki shek game da yara kuma
cewa zan yi akai kowane yaro a je a yi mai allurar rigakafin ƙyanda
adalla wannan yayi mamma
ni to ne ga wata shawara da Allah inda abin ya shafa wannan aiki ka kam ina ga akwai gudunmuwa ta gangami faɗakarwa a rediyo da ɓangaren wasan kwaikwayo ne musamman ko ba gaskiya ba ko rediyo ko talabijin ko a zagaya kasuwanni ƙauyuka kai
kwantar da hankalinka ai tunda aka ce akwai giwa gwagware ita gidauniyar ta za ta ɗauki nauyin wannan
a wannan kuma gaskiya ne wallahi gaskiya ne zo mu je yarinya kin shi sai an kai kin yi gaisuwa
to mun gode kwarai to ne mun gode kwarai kafin to bayan wasan kwaikwayo da aka gabatar akwai tsokaci wanda honorable commissioner na ma'aikatar lafiya zai gabatar. Zan gayyaci wakilinsa kuma permanent secretary na ainihin ministry din Dr. Ahmed Tijani Hamza ya gabatar da wannan tsokaci a madadin commissioner. Bayan nan za mu ɗauki jawabi na ita wadda ta assasa wannan taro kamun mai girma gwamnan jihar Katsina ya sa albarka wanda yake shine abu na ƙarshe. Permanent secretary sir.
His Excellency the Executive Governor of Katsina State, Madam Umar Dikko Radda, PhD, ably represented by the Secretary to the Government of the State, Her Excellency, the First Lady of Katsina State, Garkuwar Marayu, Giwar Gwagwaren, founder and CEO of Safe Space Humanitarian Initiative, Hajiya Zulaihat Radda, the Honorable Commissioner of Women Affairs, the wife of the Honorable Speaker of Katsina State, our respected traditional rulers, the representative of the Emirate Council of Katsina and Daura, the CEOs of the Ministry of Health, the development partners that have been supporting the health sector in Katsina State, the panelists that were here with us, other distinguished participants, Assalamu alaikum. It is my honor and pleasure to stand before you to represent the Honorable Commissioner of Health, who is unavoidably absent and who is engaged in other official engagements outside the state. He sends his goodwill message and best wishes on this auspicious occasion of the one-day sensitization on the upcoming introduction of MR, that's Measles and Rubella vaccine across the country, hopefully in October this year. The last couple of hours have been very exciting, educating, and enriching. We've had presentations from many esteemed stakeholders giving us overview of what this measles and rubella vaccine entails and the devastating effect of these two diseases. We've had the panel discussion by experts who have explained to us the significance and devastating effect of these two diseases. At the end of it, we've realized, that we need to act fast by ensuring that this one-day sensitization becomes very, very fruitful, especially because of the effect of these two diseases on children. We have heard, that measles leads to a lot of short-term and long-term complications. It may lead to severe disease and death, and in the long term, it may lead to blindness and malnutrition, which will affect the development of the child. The same applies to rubella, which is a lesser known disease that is very similar to measles, and we've heard of the devastating effect of this rubella. For the rubella that is little known, we couldn't have a house name for it. However, some suggestions were made that rubella should be called Gwagwaren, and some refer to it as Iska. However, as we are aware, the community knows Iska, to be the milder form of measles. So at least we have these two names, that we can refer to rubella. The meeting today is meant, to ginger us to get ready to sensitize the public and ensure the public awareness and buy-in by the community. So at the end of the day, we hope that, the community will give a buy-in in uptaking this very important vaccine to reduce the burden of measles and rubella in Katsina State. We are happy, that in our midst we have Her Excellency with us, and we know the role that SASHIN has played in interventions in health sector. Her Excellency has ensured, that SASHIN has partnered with the Ministry of Health and other significant parastatals in bringing down the incidences, of some vaccine-preventable disease. SASHIN has partnered with us on the issue of malnutrition and on the issue of immunization, and also on the issue of empowerment of women, which indirectly positively impacts on health. So on our part, we have a long way to go. This is just the first step, kickstarting a process which eventually will lead to success in October with the rollout of the vaccination campaign. So we have a lot of role to play. We have various levels of stakeholders. We on the government side, we have the development partners that are here. We have the community-based organizations and other community organizations. We have the traditional leadership that is all supposed to form a common front. As was earlier mentioned, we should have a united front to ensure the success of this exercise. So on the part of the state, a lot has been done with regards to the issue of improving maternal and child health. A lot of structures are in place to ensure that we have a very high uptake of immunization activities. As we are aware, we have the very high level platform, the State Task Force on Immunization and Routine Immunization and Polio, which is chaired by His Excellency the Deputy Governor. We have other platforms such as the State Social Mobilization Committee, and we also have at the local government level these local government social mobilization committees, together with other relevant ministries, Ministry of Education, Women Affairs, and other relevant organizations that actually are very significant in raising awareness and sensitizing the community. We are sure that at the end of the exercise, we will be able to raise awareness among the public to ensure the uptake of this vaccine. So with this, at this juncture, we need to understand the next steps to take from this very successful one-day sensitization. As far as we are concerned, the goal has been achieved of this one-day sensitization. However, from this sensitization, we need to take some steps. One of the steps, is to carry the message forward. As we said, we have many enablers in the state. We have the structures at the state and parastatals. We also have the non-governmental organizations that are supposed to support us in carrying the message up to household level. We have the traditional, the religious institution as well. Second is to carry the message of dispelling myths and misconceptions with regards to vaccine uptake. We've heard from the experts, about vaccine hesitancy among members of the community. So there is need for us to dispel these rumors, the misconceptions during the message we are carrying to the lower level. The last is for us to get prepared for the rollout of the vaccination in October. How do we get prepared? We have various levels. At the state level, as I said, we have various platforms. We are all supposed to get ready. On the supply side, we are supposed to get ready as policy makers, and at the same time ensure that we train the health workers with regards to implementation of this MR vaccination. Once they are trained, and then we go to the communities and mobilize. So once these next steps are done, The vaccines are ready. The structures are there. So what is expected of us is to sensitize the public to ensure that we have a very high uptake. And as we have seen, the target is 95%. Inshallah, going by the previous rollouts we had, the most recent is the HPV vaccine for cervical cancer. Recently, we have also had rotavirus rollout, and they are very, very successful. So I am certain that with this caliber of critical stakeholders that are gathered here, today has been achieved. So what is expected is for us to implement the next actionable steps. So having said that, I want to further express, our profound gratitude. We are the Ministry of Health to the Executive Governor of Katsina State for prioritizing healthcare in the state. Virtually all components of the health systems have been touched by His Excellency in the last 2 years. I also wish to further profoundly appreciate Her Excellency through her laudable projects under her pet project and organization, the Safe Space Humanitarian Initiative, for partnering with us to achieve a lot with regards to maternal and child health. And I fervently hope that we are going to continue with the partnership to ensure that we improve maternal and child health in Katsina State. In closing, I am excited, that today has been achieved. Today's goal has been achieved, and we look forward to the implementation of the MRS vaccination in October, inshallah. Thank you very much for listening. Your Excellency, the Governor of Katsina State, ably represented by SGS, Her Excellency, the First Lady of Katsina State, I wish to adopt the existing protocol. Muna godiya ga Allah da ya nuna mu wannan rana da muka haɗu, don wannan gangami na maganar allurar rigakafi na ƙyanda da ƙanwar ƙyanda kamar yadda aka ba da shawara. Wannan yana da muhimmanci kwarai da gaske saboda wannan cututtuka suna da illa kwarai da gaske ga al'umma. Mun riga mun ji a wajen ƙwararru kan illar measles, shi wannan ƙyanda da kuma illar ita rubella wadda ake suggesting a ƙanwar ƙyanda. So waɗannan abubuwa suna da muhimmanci kwarai da gaske. So kuma duk mun ji abinda kowa ƙwararru suka faɗa. So a wajena da kuma mu da muke tare, na san duka kusan mun yi achieving wannan goal na yau na kamar faɗakar da jama'a da kuma duka masu ruwa da tsaki na maganar ita wannan allura ta rigakafin ƙyanda da ita rubella. So insha Allah mu kuma at our level za mu ci gaba da partnering, za a ci gaba da haɗa kai tare da ita Ministry of Health da kuma sauran masu ruwa da tsaki, ma'aikatai kula da hidiman mata da ma'aikatar ilimi da kuma wannan kungiya ta Her Excellency SASHIN, insha Allah, da kuma su partners, the Center for Well-being and Innovative and Integrated Nutrition Solution. Insha Allah muna fatar nan da October za a yi wannan gangami na wannan allura, kuma za mu yi targeting 'yan wata 9 da zuwa shekara 15. So yanzu me ya kamata bayan wannan mu yi? Na farko shine duk abin da muka ji yanzu ya kamata a tafi a rika faɗa ma mutane har zuwa ƙasa. Muna da levels kala-kala. Akwai kwamiti na wayar da jama'a na jiha da kuma na local governments. Sannan kuma muna da ƙungiyoyi waɗanda ba na gwamnati ba, waɗanda duka suna nan. Muna so duka amfani da wannan dama, duka a tafi da wannan saƙo a gaya ma jama'a. Muna da lokaci, muna da wajen wata 2 kafin mu implementing ko wata 3. Mu a wajenmu duk kusan an shirya da su waɗannan sinadarai na allurar rigakafi. Sannan kuma za mu je a yi ba su ma'aikatan mu horo akan wannan gangami da za a yi a Oktoba. So a wannan juncture din ina ƙara godiya ga shi shugabanmu, shugaban jiha, gwamnan jihar Katsina, akan yanda ya yi abubuwa da yawa kuma ake yi a health sector a cikin wannan shekara biyu. Sannan kuma ina ƙara godiya ga ita uwar gidan His Excellency, High Excellency, a kan yadda muke haɗuwa tare da ita da wannan organization nata wajen taimakawa kan matsalolin mata da yara da kuma empowerment na women wanda SASHIN yake yi. So ina fatar insha Allahu abinda muka yi yau mu ci gaba da mu je mu implementing din shi at the lower level, especially tare da su uwayen ƙasa. So fatar mu insha Allahu in October ya zo za mu yi implementing wannan abu cikin nasara. Muna godiya, Allah kuma ya kai mu lokacin lafiya. Thank you very much.
Thank you, Permanent Secretary. Speaking on behalf of the Honorable Commissioner of Health. Before the speech by His Excellency, the Governor, it is now time for another speech, this time around by the coordinator of the Renew Hope Agenda, Katsina State. She is the deputy chair of the Forum of the Wives of the Executive Governors of the 19 states of Northern Nigeria, founder and chief executive officer of the Space Humanitarian Initiative, and of course, as well as the MAMI ambassador. Join me to invite to the podium Her Excellency, the First Lady of Katsina State, Hajiya Zulaihat, to come Radda PhD for her speech.
Mata Dikko na Radda First Lady Katsinawa. Hajiya Zulaihat gimbiyar matan duka mata. Mai tausayi ce maman mu mai kishin talakawa. Kishin talakawa. Say the First Lady. Say the First Lady. Baban kiran First Lady. Say the First Lady.
So thank you, Aluta. Thank you, Aluta. أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم. His Excellency, the Executive Governor of Katsina State, Malam Dikko Umar Radda PhD, ably represented by the Secretary to the Government of the State, Barrister Abdullahi Garba Paskari, the wife of the Honorable Speaker, Katsina State, Hajiya Safa Nasir Daura, and also other wives of the honorable members here present. Wife of the Chief of Staff to the Executive Governor, Hajiya Mejidda Andeji, wife of the Deputy Speaker, wife of the Deputy Chief of Staff, Hajiya Maria Mukhtar Saulawa, members of the Executive Council here present, especially the Honorable Commissioner, State Ministry of Health, represented by the Permanent Secretary, Ministry of Health, Dr. Ahmad Tijani, the Honorable Commissioner, Minister of Basic and Secondary Education, Hajiya Zainab Musa Musawa, and also the Honorable Commissioner of Women Affairs, Hajiya Hadiza Abdul Qadir Adua, SA Health, Nurse Umar Mamada, His Highness the Emir of Katsina, represented by the Entakan Katsina, Alhaji Sada Muhammad Sada, the Executive Secretary of the State Primary Health Care Agency, Dr. Shamsuddin Yahaya, the Executive Secretary, SEMA, Hajiya Binta Dangane, the Northwest Zone MRV Coordinator, Dr. Kabir Mustafa, and the Acting Algon, and also Chairman present here, Katsina, Kusada, and Kafur, and also wives of the 34 local government chairmen here present. Office of the First Lady Steering Committee members, all directors that are here, our development partners here present, religious leaders, nurses and students here present, other highly invited guests, ladies and gentlemen. Assalamu alaikum wa rahmatullahi wa barakatuhu. Good afternoon to my dear people of Katsina State. I'm honored to start before you today as we flag off the Measles Rubella Introduction Advocacy Campaign in our great state. This occasion marks a significant milestone in our collective efforts to protect the health and well-being of our children. As the First Lady of the state, I'm proud to be part of this initiative, which aims to introduce the Measles Rubella MR vaccine to our state. This vaccine has been proven to be highly effective in preventing measles and rubella, two diseases that can have devastating consequences for our children. The MR vaccine is a safe and reliable way to protect our children from these diseases. By vaccinating our children, we are not only safeguarding their health, but also ensuring that they can grow to reach their full potential. As a mother and a leader in this great state, I urge all parents and caregivers to take advantage of this opportunity to protect our children. When the campaign commences in October 2025, I encourage you to bring your children to the vaccination centers and ensure they receive the MR vaccine. The benefits of MR vaccine are many. It will protect our children from measles and rubella. It will also prevent disabilities and complications associated with these diseases. It reduces the risk of outbreaks and epidemics in our communities, contribute to the overall health and well-being of our children. Let me assure you that the Katsina State government, led by my husband, the governor, is deeply committed to the success of this campaign. As part of our renewed agenda, we have placed the health and well-being of our citizens, especially our children, at the forefront of our priorities. We recognize that our children are the future leaders of our state, and their safety is our top concern. To this end, we have ensured that the relevant authorities have implemented strict measures to guarantee the safe administration of the vaccine and provide our children with the best possible care. To achieve our goal, I am soliciting the support of wives of local government chairmen. I urge you to join hands with us in ensuring that all eligible children from 9 months to 14 years in your respective LGAs are immunized during the campaign. Let us work together to make this campaign a success. Let us assure that every child in Katsina State has access to the MR vaccine and is protected from measles and rubella. To the parents, caregivers, and community leaders, I urge you to spread the word about the importance of MR vaccine. Let us mobilize our communities and ensure that every child is vaccinated. Together, we can make a difference in the lives of our children. Let us join hands to protect their health and future. Thank you. May Almighty Allah bless the people of Katsina State and Nigeria at large. So alhamdulillah dukan yabo da godiya sun tabbata ga Allah mai kowa mai komi. Kamar yadda duka muka saurara bayanai sun gabata wurin masana da ƙwararru. Mun ji haɗarin wannan cuta kuma Allah ya taimaka mana za a kawo wannan allura ta rigakafi a Najeriya da jihar Katsina, wanda yin allurar zai sauƙaƙa mana domin yaƙar cutar ita measles da rubella. Takaitaccen bayani zan ɗan ƙara yi akan ita allurar measles da rubella. Ita rubella ba measles ba ce ba, ita cutar ƙyanda dukanmu iyaye mun santa, dukanmu mun santa. Ko ka yi ma ɗanka allurar rigakafi zai iya yin ta. So kusan iyaye mata har da mazan ma duk mun santa. So ita wannan rubella ta shigo an san da ita da daɗewa amma ba a fahimce ta ba. Idan yaro bai da lafiya da an fara ganin alamun ido, hanci, ƙuraje, zazzaɓi, ciwon kai za a ce ƙyanda ce. So akwai lokacin da za a yi ta ba yara magani, sai a ga kafin ma su completing dose ɗin ta warke ta tafi, ko kuma a gama badawa ba ta tafi ba. So daga nan ne aka yi bincike zafafa aka gano to wannan ba ƙyanda ba ce ba rubella ce, ƙaramar ƙyanda kenan. Kamar yadda bayani ya gabata ba ta tsananta kamar ita cutar ƙyanda ba. So ita ƙyanda an daɗe ana alluranta, an daɗe ana rigakafinta kamar duk yadda muka sani. Ita wannan ƙanwa ƙyandai ita ce yanzu muke faɗakar da ita, muke wayar da kan ga yanda take. Ita ma wata cuta ce mai zaman kanta da ko ka yi ma 'ya'yanka allurar rigakafin ƙyanda, so za ka iya yi musu domin kauce ma wannan haɗarin. So alhamdulillahi mun gayyaci duka masu ruwa da tsaki na jihar Katsina domin mu tabbatar da wannan allura ta samu karbuwa a faɗin jiha. Kamar yadda kuka sani, za mu miƙa wannan abu ga ƙananan hukumomi, za su koma ƙananan hukumominsu kamar yadda muka yi wannan gangami na taro. So muna so su mayi wanda ya fi namu, saboda kun fi mu kusa da al'ummar karkara. A kirawo mutane, most especially mata, a yi musu bayani kamar wanda kuka ɗauka a nan ku je can ku yi musu. A kowace ƙaramar hukuma, matar shugaban ƙaramar hukuma ita za ta wakilci wannan gangami da za a yi a ƙaramar hukumanta, wanda akwai cikin kwamitin da muka haɗa, akwai hakimi na wannan ƙaramar hukuma, akwai malaman addini, akwai wakilaina. So wakilaina a kowace ƙaramar hukuma ya kasance matan wanda mijinsu yake daga cikin state officials ɗin jihar Katsina. So su ne wa'inda za su zama wakilai, ko kuma wa'inda suke cikin kwamiti ɗina wanda za su koma ƙaramar hukuma domin su tabbatar da ingancin wannan gangami ya inganta. Kamar ni ta ɓangare na under state level, ga Dr. Kabir nan shi aka turo min daga Abuja, ku je ku fara wannan gangami na wayar da kan allurar rigakafin rubella. So muna expecting ɗinku insha Allahu tunda allurar ta kusa, daga gobe mun buɗe fage a fara insha Allahu. Kuma duk ƙaramar hukumar da ta zo ta ɗaya akwai kyautar da za mu bata da izinin Allah. Kuma muna ƙara tabbatar ma ita wannan ƙungiya ta C-Wings da ta yi introducing ɗin vaccine ɗin nan a Najeriya, da bi isnillahi rabbi za mu iyakacin bakin ƙoƙarinmu a jihar Katsina, ba ma 95% ba, bi isnillahi rabbi za mu yi 99%. Ubangiji Allah ya ƙara yi mana jagoranci na alkhairi, ya ƙara mana zaman lafiya a jihar Katsina da Najeriya da baki ɗaya. Wassalamu alaikum wa rahmatullahi wa barakatuhu.
Kankare fulrodi, auduga gidan yin yaji, ke ake yin taki, marasan dikin fi karfin bodi. Anti zile fezile, zile fezile, zile anti.
Thank you. Thank you very much. That has been the speech by Her Excellency, the First Lady. At this point in time, it is my honor and privilege to warmly invite the representative of His Excellency, the Executive Governor of Katsina State, the Secretary to the Governor of the State, to please deliver the speech on behalf of His Excellency.
أعوذ بالله السميع العليم من الشيطان الرجيم الحمد لله والصلاة والسلام على رسول الله. Her Excellency, the First Lady of Katsina State, Hajiya Zulaihat, Dikko Radda, the wife of the Right Honorable Speaker, Katsina State House of Assembly, the wife of other members of Katsina State House of Assembly here present, the Honorable Commissioner, Ministry of Health, being represented by the Permanent Secretary, Ministry of Health, other Honorable Commissioners here present, Special Advisors, Executive Secretary, Primary Healthcare Development Agency, the Northwest Coordinator, His Royal Highness the Emir of Katsina, being represented by the Endakan Katsina, other officials from the federal government and the state government here present, development partners, resource persons, distinguished ladies and gentlemen, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Like it has been mentioned by the MC, His Excellency, the Governor of Katsina State, Malam Dikko Umaru Radda, ought to have been here because of the importance of this program. But because of some other critical state engagement of which requests his attention, and the fact that he could not be in two places at the same time, this facilitated or brought the need for him being represented by my humble self here today before you. My task is a simple one. I will just go through the speech of His Excellency the Governor before me. I am delighted to welcome you all to this momentous occasion, marking the introduction of the Measles Rubella vaccine in Katsina State. Today we take a significant step towards protecting the health and well-being of our children and ensuring a brighter future for our state. As we all know, measles and rubella are highly infectious diseases that can have severe consequences, particularly for our children. These diseases can lead to serious health complications, including blindness, deafness, and even death. However, with the introduction of the measles rubella vaccine, we can significantly reduce the risks of these diseases and protect our children from these devastating consequences. The government of Katsina State is committed to providing quality healthcare services to our citizens, particularly children. We recognize that healthcare is a fundamental human right, and it is our responsibility to ensure that our citizens have access to healthcare services. Our administration has made significant strides in bolstering primary health care. Substantial investment has fueled numerous projects, including the revitalization of over 260 primary health care facilities across all the 34 local government areas of the state. These efforts involve upgrading and renovating primary health care centers, providing equipment, construction of staff quarters, solar lighting, and the tricycle ambulances. We have also solarized the state cold store and construct the primary healthcare coordination center, all in an effort to strengthen immunization in the state. Recognizing the vulnerability of certain populations, the administration has enrolled 28,813 number of children under the age of 15 years into health insurance and procured ready-to-use therapeutic food for the CMAM program for management of acute malnutrition. The government has also demonstrated commitment to addressing health crisis by allocating funds for epidemic-prone diseases like diphtheria, cholera, cerebral spinal meningitis, outbreak responses, and implementing a free Medicare scheme. The introduction of Measles Rubella vaccine is a testament to our shared commitment to improving the health and well-being of our children in the state and the country at large. I would like to express my gratitude to our partners, including the National Primary Healthcare Development Agency, World Health Organization, UNICEF, and other stakeholders who have worked tirelessly to make this vaccine available to our state. Their support and collaboration have been invaluable, and we look forward to continue our partnership in the years to come. Call to action. As your governor, the health and well-being of our people, especially our children, remain my top priority. I strongly endorse the Measles Rubella vaccine, set to be introduced by the federal government, the state government, and the development partners in October 2025. Measles and rubella infections are highly contagious diseases that can cause deafness, blindness, heart defects, brain damage, and even death in children. Thankfully, the Measles Rubella vaccine provides safe and effective protection. I urge all parents, guardians, and caregivers to ensure that children aged 9 months to 15 years receive this life-saving vaccine during campaign. Vaccination not only protects our children, but also strengthens our economy and healthcare system. In line with the renewed hope agenda of His Excellency President Ahmed Bola Tinubu, GCFR, our vaccines are available and accessible. I call on all our traditional rulers, religious leaders, health workers, our community influencers, and to support this campaign and ensure full coverage. Together, we can eliminate measles and rubella from Katsina State and Nigeria in general. Thank you. May God bless Katsina State and the Federal Republic of Nigeria. So, alhamdulillahi, kamar yadda bayani ya gabata, ina wakiltar mai girma gwamnan jihar Katsina Malam Dikko Umaru Radda, wanda ya ƙudurin ya zo wannan taro saboda mahimmancinsa da kuma saƙonni masu mahimmanci da za a gabatar mu al'ummar jihar Katsina. Amma saboda aikin jiha da kuma wasu ayyukan da masu mahimmanci kuma da suka taso, ya zamanto ba zai yiwu gwamna ya zamanto yana wuri guda biyu ba a lokaci ɗaya. Shine dalilin da yasa ni nake wakilcinsa a cikin wannan taro. Allah cikin ikonsa kuma yana wani aiki duka saboda ci gaban al'ummarmu da jihar mu baki daya. A to bayanai sun gabata a nan dukanmu. Na tabbata haga Allah a dukanmu da muka zo a wannan wuri, daga farkon lokacin da muka shigo da kuma yanzu da muka zo kusan karshen wannan taro, mun fahimci wani abu wanda da ba mu sani ba. Su masana su ne suka sani, su waɗanda suka sanin sun ƙara tunatar da kansu. Mu kuma da ba mu sani ba, mu kuma mun san wani abu yanzu wanda da ba mu sani ba dangane da ita wannan cuta, saboda an yi bayanai a masana sun gabatar da bayanai masu gamsarwa da hotuna da bayanai wanda za mu fahimci me yake a ciki. Da na so a ce in an ce kyanda to a tsaya mana sai an kara da wani abu da to amma yanayin illar ita wadda ake kira wai kanwar kyanda ko kuma kawarta ko kuma kyandar jamus duk sunayen nata ne, to duk wani suna da za a iya a fahimce ta ina ga ya dace, ba don komai ba saboda tsarin ta daban da ita waccan kyanda, kada a tsaya akan kyanda kadai, a'a akwai wani abu kuma. So duk wanda yake ji ana gangami an ce kyanda da kuma kyandar jamus, to ba duk kyanda kenan ba, to ya san cewa abu biyu ne, ga ita kyanda da aka sani kuma ga kyandar jamus, kuma bayani yadda suke aiwatuwa ya sha bamban. Ita an ce bata cika zafi ba, shi yasa aka kira ta wai kanwar kyanda. To ashe ko dan yaya kaga alamu kamata yayi da gudu a garzaya asibiti. An ce matambayi baya bata, kuma a rigakafi ya fi magani. Ba don komai ba saboda illar ita waɗannan cututtuka kamar yadda muka gani a yaro ƙarami tun yana ƙarami ta ido ta ji, to baki ɗaya rayuwar yaro an ɓata shi, kuma an ce yara su ne manyan gobe. To idan su manyan namu ashe dole sai mun yi aikin da ya dace a yau in muna so goben mu ta yi kyau, kuma wannan aikin na kowa da kowa ne. Shi sanya ko a nan duk wasu masu ruwa da tsaki da ya dace su shiga cikin wannan gangami suna a wannan wuri, a tun daga federal government zuwa state government. In ka taho a gwamnatance ga gwamnati a tsaye, ga mai girma wai gidan gwamna tana jagoranta ingantar da wannan gangami. Sannan ka duba ta bangaren majalisa ga wai gidan shugaban majalisar dokoki da kuma sauran matan 'yan majalisa ta bangaren majalisa kenan. So in ka duba ta bangaren ƙananan hukumomi kuma ga ciyamomi kuma ga matansu, ga wajen sarakuna kuma tun gashi tun daga mai martaba har sauran duka, sannan ma'aikata tun daga jiha federal government har zuwa can ƙasa. To ita kuma gwamnatin jihar Katsina dama tun farko ta yi tsare-tsare na musamman saboda ci gaban al'umma ta wajen inganta aikin kula da lafiyan al'umma baki da. Za a iya tunawa mai girma gwamnati tun a wajen kamfen ya yi alkawali cewa za a samar da a cibiyar kula da kiwon lafiya ta al'umma a kowace ward na wannan jihar. Muna da ward 361. Allah cikin ikonsa kafin shekara 2 ta cika an samar da waɗannan cibiyoyi guda 260. So wanda suka rage kusan a ce 101, kuma ga kusan shekara 2 a gabanmu. So ashe da yadda Allah za a gama wannan kamar yadda aka tsaro, kuma a ƙara da wasu akai. Sannan akwai asibitoci ƙanana waɗanda aka yi upgrading, wasu an gama wasu kuma ana cikin aikinsu. Sannan kuma gwamnati ta aika da 'yan asalin wannan jiha, yara 'ya'yan talakawa zuwa ƙasashen waje saboda su yi karatu na likita saboda inganta lafiyar al'umma duka baki ɗaya. To waɗannan tsare-tsare suna nan da yawa, kuma a wannan tsarin ma ita wannan allura kamar yadda su masana suka yi bayani a nan wurin tana buƙatar gangami da kuma tsari da tanaji na kuɗi, saboda ba don komai ba a yanayin da za a aje su ma dole suna da wani tsani kamar yadda masana suka bayar, kada zafi ya yawa kada sanyi ya yawa, haka za su tafi ana yin su, in ko ba haka ba za ta lalace ko an yi allura ma ba ta da amfani. So akan wannan yasa gwamnati ta yi ƙudurin samar da asibiti aka hada shi da hasken rana saboda a samu wuta ta musamman a kowane lokaci babu katsewa. To da sauran tsare-tsare suna nan da dama. Sannan kuma gashi ita uwar gidan mai girma gwamna ta jagoranci yakin gangamin da kula da lafiyan al'umma baki daya kamar yadda ta yi bayani kuma tana a kai, kuma ga sauran duka masu ruwa da tsaki a cikin wannan al'amari suna nan a wannan wuri, kuma wannan kamfen ya fara daga nan wurin kamar yadda aka yi magana. Za a ci gaba da warware shi har zuwa Oktoba da za a kaddamar da shi baki ɗaya. Yanzu duka tsare-tsare ne ake yi. So ina ga ya dace na tsaya a nan mu ƙara yin godiya ga duk waɗanda suke da hannu a cikin wannan aiki na alkhairi, saboda an ce gyara kayanka bai zama sauke mu raba. Wannan abu namu ne na kowa da kowa ne, saboda haka sai dole kowa da kowa ya ba da gudunmuwarsa saboda samun nasarar wannan gangamin da kuma gabatar da ita wannan allura ta rigakafi. Na tsaya a nan, muna mana fatan alheri da kuma duk waɗanda suke da cikin wannan aiki na alheri muna roƙon Allah ya saka musu da alkhairi. Amma madadin mai girma gwamnan jihar Katsina Malam Dikko Umar Radda muna ma kowa fatan alheri da addu'an Allah ya mayar da kowa gidansa lafiya. Na gode.